right, good morning, everyone, and Happy New Year. Believe it or not, we're on to our 2026. So I'd like to call this meeting of the California Veterinary Medical Board to order. But before we begin our roll call, I'm pleased to welcome our newest public board member, Ms. Anna Orlowski, who is the Chief Counsel for the University of California Davis Health. And she brings a wealth of experience from the human healthcare law as well as from volunteering her services to San Francisco Humane Society and Pasadena Humane Society. Her practice includes state and federal regulatory issues, telehealth, joint ventures and affiliations, privacy, medical staff matters, licensing and accreditation issues, and faculty and resident medical student related matters. We are very grateful to have Ms. Orlowski join us and look forward to her valuable contributions to the board. Welcome. Now I would like to request our EO to conduct the roll call.
Dr. Solcito,
Here.
Ms. Pulowski,
Here.
Dr. Bradbury,
Here.
Mr. Espinoza,
Here.
Dr. Maniak,
Here.
Mayor Mitchell,
Here.
Mr. Orlowski, Dr. Tomlinson.
Here.
We have a quorum.
Thank you. And before we move on to our agenda item 2, the board would like to begin with the land acknowledgement. This serves as a formal recognition of the indigenous peoples whose ancestral lands we gather on today. We respectfully acknowledge the Nisinan, Southern Maidu, Valley and Plains Miwok, and Patwin Wintun peoples, as well as Sacramento's only federally recognized tribe, the Wilton Rancheria. These communities have stewarded this land for generations and continue to contribute to its cultural and social fabric. This acknowledgement reflects the board's ongoing commitment to fostering respectful relationships and collaboration with tribal nations on matters of mutual interest and concern. And so now we move on to agenda item 2, which is items not on the agenda.
So it's public comment for items not on the agenda. So we can take public comment from the room first.
Okay. Looks like there's none. So moderator, could you please open up WebEx for our folks participating online?
Absolutely. Now is the time to raise your hand on WebEx. You can do so by tapping that hand button at the bottom of the screen. Dial-in users need to dial *3 in order to raise their hand. People will be given 3 minutes to speak, and I'll give you a 15-second warning before your time expires. We're going to take just a few seconds longer to see if we have a request for public comment for items not on the agenda. Seeing no request, you wish to continue with the agenda?
Yes, please. Thank you. And now we move on to agenda item 3.
So members, I had emailed all of you. We received a couple concerns that the board meeting minutes didn't accurately reflect the complete discussions that were had during the MDC and the board. And so we are tabling these meeting minutes, and we're going to take them back to everybody in April. So we can move on to agenda item 4.
Okay, so now we're moving on to agenda item 4, which is the report and update from the Department of Consumer Affairs.
Good morning, board members. My name is Judy Bucciarelli from the Executive Office, Board and Bureau Relations. And I'd like to thank you for the opportunity to provide the DCA update today. My first item is a DCA executive team update. We're excited to announce that Chief Deputy Director Christine Lowley has been named the Acting Director of the Department of Consumer Affairs. She enters this role following the retirement of DCA Director Kimberly Kirchmeyer. Director Lally brings extensive experience to the position, having served in multiple leadership roles within the department since 2013. She will lead DCA in this position until a director is formally appointed by the governor's office. The DCA Executive Office would like to thank the board and staff for their hard work and partnership last year. We are excited about 2026 and the many opportunities that await us. Next, on January 8th, Governor Newsom delivered his final State of the State address, reaffirming California's role as a national beacon for democracy and an economic engine with conscience, pushing back against federal overreach while boldly investing in jobs, education, affordability, climate action, and recovery from the LA wildfires. The governor's proposed budget is balanced for the coming fiscal year, reflecting a surge in state revenues, forecasting more than $42 billion higher than projected at last year's enacted budget. The budget does not include new significant spending proposals. Instead, it builds on prior policy successes and continues to implement critical investments in priorities such as education, affordability, small businesses, wildfire mitigation, and more. This month marked 1 year since the devastating firestorms that swept through LA County. California remains committed to helping survivors recover with an all-of-government approach, building on efforts that have accelerated recovery and supported communities. On this anniversary, DCA 2 reaffirms its commitment to support survivors and helping the community heal. Next, I have information on renewal fee postponements. Governor Newsom took action to assist licensees affected by the LA fires and swiftly issued an executive order to allow a 1-year postponement of renewal fees for survivors impacted by the fires that were due for renewal between January and June of 2025. DCA began sending notices this month to licensees who renewed their license in 2025 and chose this postponement option with a reminder about the 1-year postponement and renewal fees due dates. Licensees with license types in the Breeze system can pay these renewal fees through their online account. All licensees with license types not in the Breeze system may submit their payment via email. And next, I have an update on the governor's reorganization plan. Last year, Governor Newsom released his proposed 25-26 state budget, which included a proposal to split DCA's oversight agency, the Business Consumer Services and Housing Agency, into 2 state agencies, the California Housing and Homelessness Agency and the Business and Consumer Services Agency. After public hearings and review by the Little Hoover Commission and the legislature, the governor's reorganization plan was enacted on July 5th, 2025. The new Business and Consumer Services Agency will be responsible for consumer affairs, licensing, and enforcement, and the Department of Consumer Affairs will be among the 8 departments in this new agency. The 2 new agencies will officially become operative on July 1, 2026. DCA continues to participate in multiple agency work groups on the logistics required to transition to the new agency and will continue to keep board and bureau leadership apprised throughout the months ahead. And next, I have a few travel reminders. To best serve the public, it is incumbent upon all of us to ensure that we are being fiscally prudent in our decisions, especially when traveling for board business. DCA would like to remind members and staff to evaluate if a rental car is always necessary versus ride-sharing services. Carpooling is also highly encouraged when renting vehicles. We know that there may be new travel costs board members are experiencing as well, such as baggage charges, so please keep receipts to ensure that you can be reimbursed. If you have any questions, please reach out to memberrelations@dca.ca.gov so we may assist you. Next, as we kick off a new year, DCA also wanted to provide a reminder about Form 700, Statement of Economics Interest Filing. These forms must be filed within 30 days of assuming or leaving your appointment and annually by April 1st. This year's annual filing period covers the prior calendar year, January 1 through December 31st, 2025. The deadline for filing this year is Wednesday, April 1st, 2026. To ensure compliance, DCA requests that Form 700 filers complete the e-filing by Friday, March 20th. DCA board members must file Form 700s through the FPPC's online portal. Paper filings will not be accepted. You should have received an email from the FPPC with instructions on how to file your annual Form 700. If you have any questions, please contact Board and Bureau Relations, again at memberrelations@dca.ca.gov. And I have a few training reminders and information. Unconscious bias training. DCA's training unit has developed unconscious bias training specifically for board members. This training will be added to members' LMS accounts by January 30th and incorporated into the onboarding process for all newly appointed board members. Next, President's Training will be held on February 24th from 10 a.m. to 12:30 p.m. This virtual training is for board presidents, vice presidents, and Bureau Advisory Committee chairs and vice chairs. The virtual training service serves as a forum to share best practices for presiding over a board or advisory committee. Please register online using DCA's learning management system. Next, board member orientation. There are several training dates this year. Board Member Orientation, or BMOT, is an all-day virtual training that DCA will offer on April 1st, June 24th, and October 21st. This training must be completed by board members within 1 year of appointment and reappointment to the board. Please register for the first available date to be in compliance. Board members can register for BMOT using DCA's learning management system. If you have any questions or need assistance accessing these or other mandated trainings, please contact Member Relations. Thank you for your dedicated service to protect California consumers every day. I appreciate your time, and at this time, I welcome questions from the board.
There you go. Looks like there's no questions from the board. Now we open it up for public comment from folks in the room. Okay, looks like there's none. So moderator, could you please open it up for folks online?
We are open for public comment on agenda item 4. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a few seconds to see if we have a request for public comment. Seeing no request, you wish to continue with the agenda?
Yes, please. Thank you. Thank you very much. Okay, next on our agenda is the review, discussion, and possible action on multidisciplinary advisory committee. Unfortunately, both our MDC chair and co-chair are not available to present this report. So as a board liaison to the MDC, I'm going to be reading to you the reports from the chair. Okay, so overview of the January 20th, 2026 meeting. It started with Dr. Waterhouse called the meeting to order at 10:01 a.m. and a quorum was established. There was no public comment on items not on the agenda. The review and approval of the October 14th, 2025 meeting minutes were tabled until the April meeting, as there were concerns regarding the accuracy of the meeting minutes. And then Dr. Waterhouse gave the committee chair report. She thanked Ms. Osiri for her time serving as committee co-chair. And Dr. Waterhouse gave Hold on. What happened here? Sorry. I'm having technical difficulties. I'm sorry. Okay, so Dr. Waterhouse gave an overview of the MDC report from the board's October meeting, including actions taken by the board. She also updated everyone on the status of pending regulations. Legislative proposals from the MDC agenda items 5A and 5B of the Veterinary Practice Subcommittee report will be covered momentarily. So I will skip over these items and come back to them later. Now, agenda item 5C was a report from the California Department of Food and Agriculture meeting. Ms. Ussery reported that the subcommittee met with the CDFA on January 9th, 2026, to discuss any updates since the last quarterly meeting. CDFA announced that they have a new director, Dr. Stephen Beam, and a new acting state veterinarian, Dr. Amanda Murray. Dr. Brady gave an update on blood banks. Their penalty regs were posted for 15-day notice on Thursday. Corporate hospitals have been ramping up their internal production, and CDFA is still fielding many questions about the incentives blood banks can offer. CDFA is still having trouble contacting veterinarians for veterinary feed directive, errors, and violations. They discussed the various ways they try to contact the veterinarians listed on the VFDs, and Ms. Zifferman noted that VFD violations can now be prosecuted by the board should CDFA decide to forward them to the board. Next item, Dr. Gedgen gave the update from the Enforcement Subcommittee. 3 new experts have been added, 2 from general practice and 1 specialist. It was noted that the consultants resolved 65% of the standard of care cases without the need for a full expert review, and 92% of the cases closed involving expert review did not result in a citation or discipline against an individual respondent. A summary of the consultant roundtable held on November 18, 2025, and the expert roundtable on November 20th, 2025 was provided. A variety of topics were discussed, including not posting anything case-related to social media, reminders about expert requirements and clinical practice experience, examples and information on passive versus active voice-in reports, information on additional resource materials for experts to obtain from the board, fees charged for reviewing records to issue prescriptions, attributing standard of care departures accurately when work is performed by supporting staff, relief veterinarian responsibility for work performed by support staff, invoice reminders for SME time. And that concludes the MDC meeting. Do we have any comments from the board members?
The MDC had also, when they were discussing whether or not they can charge for record review for written prescriptions, they had had a lot of discussion about some confusion related to the laws, and think that it should be looked at more clearly. And I think our attorney agreed that it's not clear right now, and so they had recommended that that's something that the board directs them to look into further and make recommendations if necessary.
Okay. Anybody else? All right, go ahead.
Since they're looking for direction, I think I saw that when I read the materials that it's pretty clear in, is it statute that says that we can't charge for writing a prescription? Is that pharmacy statute or is that? Yep.
It's in regulation, the vet med regulations implementing the pharmacy law statute. So the vet med regulations say a client cannot be charged for issuance of a written prescription. The problem is that while implementing the pharmacy law statute, that statute talks about before a drug can be dispensed, the practitioner must advise the patient they are allowed to get a written prescription instead of the dispensed medication. So veterinarians are subject to the pharmacy law. So that's why the Veterinary Medical Board has a regulation to implement it. So it's clear that the written prescription itself cannot be charged for. The question is, because of, over time, how things have developed, did it mean at the time, I just examined the patient, I would like to dispense a medication, you have the opportunity to have a written prescription where you can take it to whatever pharmacy you want. Well, later, as we're finding out, clients are now calling veterinary premises for refills. And now they want a new written prescription that they can pick up and take to their pharmacy, or the potentially refill is submitted to a pharmacy. Now, if the veterinarian who examined the patient is not available, somebody else is looking at this, now they're having to spend time reviewing the medical records. Can the veterinarian charge for that record review? They can't charge to write the prescription, but can they charge for the time spent to review the medical records, to issue the refill and transmit the prescription to the pharmacy, or provide the written prescription directly to the client? That's really the question and the timing problem of it.
Yeah, thank you. That is much better than I could summarize that. So I've been involved in that, and with my cases, I have, as an internist, pages and pages of records, and then when I'm not there at the hospital, an emergency doctor is now being asked to review the records to refill something when somebody calls, and it can take a long time. So I think it is important that we do look at this, because it is it's difficult, right? It's not like you want to be able, you want people to be able to get a prescription um, without being charged for it necessarily, but at the same time, it is a lot of time that is put into it. And so I would be in favor of having the MDC review this.
I understand and respect the opinion that it takes time for that to occur. My question is this consumer protection? I don't believe it has anything to do with consumer protection. It's a charging matter, it's a business matter. I understand that there are conflicting laws, and that's part of the confusion. But because there are conflicting laws regulating this, and the fact that we're supposed to be protecting consumers, this has nothing to do with consumer protection in my view.
Go ahead.
I like that perspective. I guess I would say that if people were allowed to charge, they may be able to take a little bit more time. And I know they're meant to be thorough and they're required to be thorough, but I think it would be an incentive to be more thorough. So that would be just a thought.
Are you saying you would encourage the MDC to interpret it the way that I thought it was originally done, where when you examine the animal, you hand them a prescription and you cannot charge for that prescription because you just examined the animal? And if your prescription has no more refills, that means they can't get them without another exam or something. And are you saying that something could be a records review that you could charge for?
I think that would be one way to do it. What I'm saying is really just that I think it's reasonable to ask the MDC to look at different options and see what options there are, whether this is something that is consumer protection or not, because they may review this topic and come back and say, no, you know what, this is just a charging thing and this isn't a purview of the board.
Okay.
But just to look at it.
Go ahead.
I think I agree with everybody up here, which is like, I know that's hard to say that because it's different, but I believe that it is consumer protection to say with that we're looking at this and it's not a in the purview of the board about fees. However, I do believe that there is so much confusion about this that it's important for the MDC to be able to look at this and review it and make sure that we clarify the language and the outreach to consumers and to the profession to make sure that we can provide accurate information to everybody involved.
I would just also say that if it's not the purview of the board to manage fees, then why are we saying they can't charge for it?
So it is the purview of the board when we have a law that says they can't charge for it. So we are able to look at that law to see if there's confusion. The MDC can see whether or not the law should be changed or if there needs to be more education to the profession on the different scenarios of when they can charge.
I had a question. What are the two statutes at issue that are creating the conflict, if people know, or regulations that are creating the gray area?
Yeah, to be clear, there's no conflict. The issue is that the written prescription has to be offered to the patient under pharmacy law prior to dispensing a medication. So they have to be offered a written prescription. Under the vet med regulations implementing that pharmacy law, it says, reiterates the requirement to offer the written prescription. And then the regulation says a fee shall not be charged to the client for the written prescription. The question is, there's a confusion about whether or not the veterinarian can charge for the acts leading up to writing the prescription. So that record review, can they charge to review the records, even though it's very clear they cannot charge for the written prescription? But can they charge for everything affiliated with writing the prescription?
Just to clarify, based on the conversation yesterday, I think the concern was more about refills. It's not the initial prescription. And I think veterinarians know and follow, the regulations about not charging for the written prescription, but it's at the point where clients are asking for refills, which could be 3, 6 months, 12 months down the road. And I think that is when, in the absence of the original veterinarian who wrote the prescription, a lot of times the responsibility falls on the other veterinarians on site to review the record to make sure, that they're good for a refill or not. So that's, I guess, just to put it in context for those who were not at the meeting yesterday. So. Okay, I guess we open it up for public comment. Oh, go ahead, Tara.
Mr. Espinoza, just to be clear, you asked for the laws, and I want to provide you that information and also to the public in case anyone was asking. Business and Professions Code Section 4170, Subdivision A 6 and 7. That's the pharmacy law at issue. And then the Veterinary Medical Board's regulations implementing BPC Section 4170 can be found at California Code of Regulations or CCR Title 16, Section 2032.2.
So I think before we go to public comment, just that if we want to, if there's a consensus to send it to the MDC, we don't need a motion, but just if that's the general consensus for the MDC to look at this further. For head nods. Yes. Oh,
Okay, I guess we need a consensus from the board if we would like this matter to be sent back to the MDC for clearer,
for the research
yeah,
and
for the research
potential
and,
recommendations.
yeah. Do we? Motion. Okay, so I guess, go ahead, Dr. Tomlinson.
I just want to be sure we're clear to them that we want to have them explain the original one and the refills as separate cases. And, well, whether a new law needs to be done, whether education, or how it can be fixed.
Okay, anybody else? All right, so I guess. Nicole? Okay. Public comment first, okay. All right, so we now open this matter for public comment for folks in the room.
Hello, Grant Miller, Regulatory Director for the California Veterinary Medical Association. In the board's assignment to the MDC, could you also please consider having them analyze Business and Professions Code 4826.6, which mandates veterinarians to transmit a prescription directly to a pharmacy? In this statute, it doesn't say that that has to be free of charge, and a lot of veterinarians are spending huge amounts of time on the phone or resending faxes or emails because pharmacies, for some reason, can't complete the basic task of filling prescriptions, which is their primary purpose. So a lot of veterinarians are calling us saying, you know, we really want to charge the client for our time because we either have to have a staff member do this or we're doing it after hours and trying multiple times. And so a lot of them are not writing, you know, pharmacy incompetence fee on the record. They're writing, you know, when they charge the client, they're writing something like records review fee or you know, they can't write written prescription fee because we know we can't charge for a written prescription, but they're writing something else in there to try to account for their time and their effort. And this statute, 4826.6, does not expressly say that they can't charge for that. So that's another aspect to it that is a new layer. This 4826.6 just passed as part of AB 1399, which was our telemedicine law. So this is a relatively new development that the veterinarian has to transmit the prescription directly to the pharmacy if the client requests it. So that's added a whole nother layer of responsibility to veterinarians. And so I think if the MDC is going to look at it, that particular statute should also be examined. Thank you.
Thank you. All right, anybody else from the room? I guess there's none. Moderator, could you please open up for public comments online?
WebEx, now is the time to raise your hand for agenda item 5. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a moment longer to see if we have a request for public comment. Seeing no online requests, you wish to continue with the agenda?
Yes, thank you. Now we move on to agenda item 5, section B, which is the recommendation on legislative proposal to amend Business and Professions Code sections 4825.1, 4826.6, 4830, and 48 40.5 regarding the veterinarian client-patient relationship and electronic veterinary services. So as a background, at its October 2025 meeting, the MDC reviewed concerns about condition-specific VCPR requirements and agreed the language should be updated to better reflect real-world practice. The MDC supported removing condition-specific language and instead adding a time-based requirement such as every 12 months. This would apply to all prescriptions and align with controlled substance rules. There was general agreement that professional judgment should remain central, with additional safeguards such as time limits to balance access and protection. During public comment, CVMA shared that they were considering legislation to remove condition-specific language and shift to a patient-specific VCPR. The board agreed that the MDC should move forward with developing recommendations to remove condition-specific VCPR language. CVMA, San Francisco, and the San Diego Humane Society have expressed alignment with the board's direction. The board's executive officer requested and the groups accepted to co-sponsor the legislation. That way, everyone can work closely together on a single bill rather than competing pieces of legislation. The subcommittee and co-sponsors met multiple times to develop the attached legislative proposal. This proposal not only shifts the condition-specific VCPR to patient-specific, but also integrates previously approved telemedicine-related definitions and concepts. By doing so, this proposal removes the unintentional narrowed telehealth scope created by AB 1399 and aligns terminology with industry standards. This memo summarizes all changes that this proposal accomplishes. Rather than detailing every modification, including purely renumbering or technical changes, the focus on the substantive changes introduced by the proposal are: for definitions, it introduces new definitions for electronic communication technology, HERD, teleconsultation, telemedicine, and teletriage. Reorganizes into alphabetical order existing definitions for animal, client, and diagnosis. And also remove the definition of synchronous and telehealth as separate terms, integrating their meanings into new definitions. It also adds a rabies exception from previously board-approved language, exempting rabies vaccination administration from the VCPR requirement to prevent disease or loss of life. For the VCPR, it removes the condition-specific language from subdivision A2 by striking to initiate at least a general or preliminary diagnosis of the animal's patient's medical condition. It also moves the client communication requirement to establish the VCPR in subdivision A3 to a separate requirement in new subdivision D to be maintained throughout the lifespan of the VCPR as follows. 3, the veterinarian has assumed responsibility for making medical judgments regarding the health of the animal patient. D, the veterinarian shall communicate with the client a medical, treatment, diagnostic, or therapeutic plan for each medical condition for which the veterinarian may prescribe, dispense, or administer treatment or whatever nature under the veterinarian client-patient relationship. If the medical, treatment, diagnostic, or therapeutic plan for a medical condition changes from that which was initially communicated to the client, then the veterinarian must attempt to communicate the necessary changes with the client in a timely manner. Then the multiple conditions can be treated under the same VCPR. The veterinarian must communicate with the client the initial treatment plan for each medical condition and attempt to communicate any changes to the plan in a timely manner. It adds a new subdivision K to establish a 1-year VCPR expiration date after an in-person examination and a 6-month VCPR expiration after a synchronous audio-video examination. These provisions would replace the existing 1-year and 6-month prescription expirations. A new VCPR must be established after the VCPR expires. This proposal also moves language from CCR Title 16, Section 2032, the point 15 to BPC Section 4826.6, new subdivision L for ease of reference. This regulation outlines conditions under which a VCPR can continue in the absence of the original veterinarian, provided a designated veterinarian assumes responsibility and maintains the established plan. It also moves language from CCR Title 16, Section 2032.25 to BPC Section 4826.6, new subdivision M for ease of reference. This regulation outlines conditions under which a drug refill may be prescribed, dispensed, or furnished in the absence of the original veterinarian. The subcommittee and co-sponsors believe that there are many benefits to this proposal. This proposal aligns with current standards of care by adopting a patient-specific VCPR. It also modernizes veterinary practice by embracing the benefits of teleconsultation, telemedicine, and teletriage, while maintaining essential safeguards for animal welfare and public trust. It will provide enhanced access to care since AB 1399 unintentionally limited the ability for veterinarians to provide care through electronic means by requiring a VCPR for all veterinary services and limiting the provisions of electronic veterinary services to only veterinarians. This proposal restores veterinary professionals' ability to deliver services electronically, enhancing access to care. It provides clearer definitions and regulations. The update definitions and requirements for establishing and maintaining a VCPR, especially in the context of telemedicine, provide much needed clarity for both veterinarians and clients. This reduces ambiguity and promotes consistent application of standards. It will provide improved animal welfare by clearly defining teletriage and clarifying how it can be used in emergencies. This proposal can lead to faster access to veterinary advice and potentially life-saving interventions. The new 1-year expiration period for VCPRs, established with an in-person examination, and a 6-month expiration period for VCPRs established via electronic examination, ensures that veterinarians maintain appropriate oversight and regularly evaluate patients' needs. This proposal also supports veterinarian to veterinarian collaboration. The clarified provisions for teleconsultations codify the existing practice of collaboration among veterinarians, allowing specialists or veterinarians in other states to offer expertise to California licensed veterinarians, ultimately benefiting the animal patient. As the discussion went with the MDC, the committee discussed and noted some confusion regarding the addition of the rabies exception, BPC 4826.6. It was clarified that this language had previously been approved by the board and is intended to address the existing practice of small animal vaccination clinics administering rabies vaccination as mandated by the state. This provision formalizes current practice. Questions regarding who may administer a rabies vaccine and under what circumstance will be addressed in the future outreach materials. There was no public comment on this item. The action requested by the MDC, if the board agrees with the subcommittee and the MDC's recommendation, please entertain a motion to submit to the California State Legislature the attached legislative proposal to amend BPC sections 4825.1, 4826.6, 4830, and 4840.5. Comments?
Do you need a motion yet?
We will need a motion.
Okay, then I so move.
I'll
there any
second and then
comments?
we can discuss.
So we have a motion and it's seconded.
So just to clarify, for the meeting minutes, the motion is to submit to the California State Legislature the attached legislative proposal to amend BPC sections 4825.1, 4826.6, 4830, and 4840.5. Thank you.
Yes.
Okay. Does anybody have any comment, further discussion? Go ahead, Dr. Bradbury.
First, I just like to say this is amazing. This is a long time coming and is very helpful to the profession and for consumer protection and being able to get care from veterinarians for their animals. And it also is really encouraging the collaboration that has gone on here with the different groups who have all worked really hard. And I just want to thank everybody for their hard work. I did want to say that I've looked at the client definition and I have a little bit of an issue with how it's worded. I know it's not part of this thing, so I just wanted to talk about that. I'm actually just kidding. That was a really long conversation. No, I think this is great. And I also like the teleconsultation.
I guess we have to give credit where it's due. This collaboration would not have been made possible if not our executive officer had made so much effort in reaching out to all parties involved. And that's why I think this is really significant for the industry. And we thank you for your initiative. Yeah.
Well, we do have to thank CVMA and San Francisco. Oh, sorry, go ahead.
Oh, actually, I do have a question, just given the conversation, and I'm sorry to be so naive, but just reading the statute as it's been amended, the 4826 statute, it seems like then for the discussion we just had, for that refill, it's been a year, patient needs a refill, that the veterinarian wouldn't be permitted to refill that medication because the veterinarian client-patient relationship had expired. So it almost would require some form of a good faith examination prior to the refill. So it almost answers the payment question, right? In other words, if you can't do it, then you have to examine the patient. And then, so I just was curious about if that was discussed.
You first.
The issue that Dr. Miller raised under the prior agenda item, public comment, it's identified. Thank you. If you'll take a look at page 10 of the legislative proposal, this is going to be new subdivision H, former subdivision I. And this talks about when a veterinarian cannot prescribe a drug for a duration of time that is inconsistent with the medical condition of the animal patient or the type of drug prescribed. Currently, paragraph 7 under subdivision I provides that a veterinarian shall notify the client that some prescription drugs or medications may be available at a pharmacy, and if requested, the veterinarian shall submit a prescription to a pharmacy that the client chooses. This legislative proposal would remove that provision entirely. So perhaps that would resolve the concern raised by Dr. Miller. But thank you, Ms. Orlovsky, for pointing that out, because I think that's a really important point.
And what I was going to continue on is this sweeping change cures so many issues like this. So I really appreciate the teamwork which our XO has done for us, because with everybody looking at it, it cleans up a lot of problems. Thank you.
I also just wanted, I'm not sure that that fully answered your question. And I think the question of whether we can charge for records review for a refill is regarding, so often we'll prescribe a medication to a patient, and then, you know, within that year prior to the requirement of the new establishment of a VCPR, which this would be saying we'd have to do yearly in order to write prescriptions, which is pretty standard in our, it just hasn't really been codified, I don't think, but it is fairly standard with what we've done in veterinary medicine. But prior to that year coming up, if those clients requested a refill on a medication and that doctor is not available, a different doctor in the practice. So it's really that time between the yearly annual visits for prescriptions that the previous discussion was talking about, not that. Does that help?
Yes, thank you.
Okay. Yeah, go ahead and ask.
But in that exact scenario, as it's now defined, which is, I'm not making a judgment, just noticing that would mean that that new veterinarian had not examined the patient either asynchronous or synchronous, via telehealth or in person. So I don't know then. Oh, I see. But they may have made medically appropriate and timely visits to the premises.
That's kind of for a large animal.
Yeah, so that wouldn't fit. So in other words, if it's a new vet who's never seen the patient, it almost seems like
we have
this
some,
would require now the new vet who's standing in the shoes of a vet who might just be on vacation to have to examine the animal. That's a pretty strict standard.
we have some provisions in our regulations that allow for veterinarians that are on the same premise, that share the same record system, can refill prescriptions in the stead of a veterinarian
Yes.
that's not there. So we have that somewhere else. It's just this, it's not in this
It's a little
statute.
conflicting, yes. So anyway.
As I said yesterday, this is a snapshot of like a snippet. And it's really hard sometimes because we're reviewing a snippet out of a very big package. And we forget that there are other pieces that go together, and we're trying to evaluate this. So there are other pieces that will protect that. And so that's where it will all come together. It's just really hard unless you sat down and read this, and then you read pharmacy law, and then you read all the others, and it's really hard.
Go ahead, Tara.
So today, regulation provides for a subsequently prescribing veterinarian, and we're actually going to add the regulation text into this statute, and it begins on page 11. It's actually subdivision M. Subdivision L is the VCPR continues to exist, and that's when treatment changes by a subsequent veterinarian. Subdivision M is for the absence of the original prescribing veterinarian. Yeah, so we're hoping to repeal the regulation provisions, so it'll all be encompassed in the statute.
Any other comments? Ms. Orlowski? Do you have more comments? Go ahead. Okay. All right. So, yeah. So now we open the agenda item for public comments for folks in the room.
Hi, Grant Miller, CVMA. Just want to express thanks to the board for collaborating with us on this really important bill, and specifically to Tara and Jessica, who have worked extensively on the language to make the bill what you see in front of you today. Just a status update, we've shopped the bill to a legislator who we feel would be a really appropriate person to carry this bill, and they're seriously considering the bill. The challenge is that we're in the second year of a 2-year legislation cycle, and legislators are allowed 50 bills in a 2-year period, and a lot of them kind of use the first year to get through a lot of bills. And so a lot of the legislators are really careful in the second year about, which bills they choose to take. So our belt and suspenders approach to this is that if this legislator opts not to take the bill, the legislator will submit the bill to the legislature, and the bill will go in as an unbacked bill, which means that we have a little bit more time to shop for an author for the bill. So let's keep our fingers crossed that we do get the author that we want, but if not, we'll be actively seeking an author, and I'm confident we'll find one. It's just we're hoping that we can get this one who we really like. So yeah, with that, I don't count the chickens before they hatch, but I'm hoping that that's the direction it will go. Thank you.
Thank you for the update. Now, moderator, could you open up WebEx for folks online?
WebEx is taking public comment on 5B as in Bravo. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a few more seconds to see if we have a request for public comment. Seeing no online requests, you wish to continue?
Yes, please. Thank you. Okay, so, we have to vote on the motion.
Ms. Pulowski,
Yes.
Dr. Bradbury,
Yes.
Mr. Espinoza,
Yes.
Dr. Maniak,
Yes.
Mayor Mitchell,
Yes.
Ms. Orlowski,
Yes.
Dr. Tomlinson,
Yes.
Dr. Solocito,
Yes.
motion carries.
All right, so we can move on to the next agenda item, which is 5C. Let me see. We can't. Okay. Agenda item 5C, recommendation and legislative proposal to add BPC sections 4846.3, 4846.4, and 4848.2, amend BPC sections 4827, 4858, 4858.1, 4858.2, 4900, or 4901, 4902, and 4905, and to repeal BPC sections 4843.5 and 4844 regarding veterinary medicine practice exemptions, retired and retired volunteer statuses, and shelter veterinarian licenses. As background, at the October 2025 board meeting, the board directed the MDC to draft a legislative proposal to create a limited shelter license to address shelter workforce challenges while maintaining adequate consumer protection. The subcommittee's recommendation who drafted a legislative proposal that creates one, a retired status for veterinarians and RVTs. 2, a retired volunteer status for veterinarians and RVTs. 3, a shelter veterinarian license. The retired status for veterinarians and RVTs allows their public record to list them as retired rather than showing their license as being expired, delinquent, or canceled, which has a negative connotation. The proposed retired status legislation also defines the application fee, the conditions for denial, how to use the professional title, board oversight, the exceptions for renewal, and notice that they cannot practice except as a volunteer in a shelter. The retired volunteer status allows retired veterinarians and RVTs to practice within their full scope of practice as long as they do so for free and solely for animal control shelters or humane societies. It also creates a streamlined process that allows out-of-state and licensed Canadian veterinarians to work in a shelter practice. The third license, the shelter veterinarian license, allows veterinarians licensed in other states to practice veterinary medicine in California solely within animal control shelters or humane societies. Like the retired volunteer status, the application process is streamlined and does not require submission of proof of graduation from a college or proof of passing the national exam. All other licensure requirements align with those for a standard veterinarian license, including submitting an application, paying applicable fees, fingerprinting, and successfully completing the veterinary law examination. Unlike the retired volunteer status, the shelter veterinarian license allows veterinarians to be paid for their services. Their license does not extend to RVTs because the licensed technician requirements and scope of practice vary widely across the United States and Canadian provinces. Some states do not even regulate technicians. As such, the board cannot be assured that the RVT applicant met the board's education and national examination requirements in another jurisdiction. As presented by Dr. Sullivan, for each section, I would like to go on with the summary notes. One, this legislative proposal will repeal BPC sections 4843.5 and 4844 as they are covered under BPC sections 4901 and 4902. The legislation will create the retired license status by adding BPC 4846.3. Many professionals have the classification of retired, and we are updating our code to provide the status so that retirees do not have the status of expired, delinquent, or canceled. It also allows us to create the status of retired volunteer, which he will go to shortly. Yeah. So next, we are proposing add section 4846.4, the retired veterinarian volunteer and retired RVT volunteer categories. We are proposing to add section 4848.2, shelter veterinarian license. BPC sections 4858, 4858.1, and 4858.2 on the bottom of page 10 and over to page 11. This is clean-up language for these sections. The BPC sections 4900 subsection B2 is added language to require the renewal of premises registrations to confirm that the information in subdivision C, D, and E of sections 4853 is current and valid. This requirement is to correct an oversight of not including this information on renewal applications when the statute was originally written. BPC section 4901 is amended to show how a license, registration, or permit may be renewed or restored to active status within 5 years after its expiration. BPC 4902 is cleanup language to clarify what happens if a license, registration, or permit is not renewed within 5 years, and subsection B states the conditions of how a license or registrant can be restored to active status if it has a retired status for more than 5 years. BPC 4905, subsection B 21 through 27 set the fees for the application of the retired status, the application of the retired volunteer status, the biennial renewal fee for the retired volunteer status, the fee to restore a license or registration from retired status or retired volunteer status to active status, the fee for the shelter veterinarian status application, initial shelter veterinarian license fee, and the biennial shelter veterinarian license fee. By enacting these new license classifications into statute and including a range of fees, these categories will be effective as soon as they become law. As per the MDC discussion, Ms. Polowski asked if we have a definition of humane society in the Practice Act, and we do not. The memo discusses terminology and extending this to other organizations on page 5. Dr. Nunez asked about the law exam that is referenced. Clarification was provided that this is the exam developed and administered by the board. Dr. Nunez also asked if this would harm consumers. Ms. Zifferman explained the safeguards that are still in place, such as fingerprinting, and the renewal requirements remain the same. He also asked if we are certain that this will help shelters. Ms. Zifferman said that we are hopeful. This was based on feedback from shelters and Animal Balance. They wanted a streamlined way for shelter veterinarians to become licensed in California. And I stated that this would allow veterinarians to come to California to practice seasonally to help with large events. I said that the providing these services would greatly help consumers because not doing so could cause additional consumer harm. Ms. Zifferman explained that the fee structure provided was based on what other boards are doing, as well as the amount of maintenance that will be required by staff, and whether it is a paid position. The shelter veterinarian license fees mirror those of the university license. There were no public comment on this item. The action requested by the MDC, if the board agrees with the subcommittee and MDC's recommendation, please entertain a motion to submit to the California State Legislature the attached legislative proposal to add BPC sections 4846.3, 4846.4, and 4848.2, amend BPC sections 4827, 4858, 4858.1, 4858.2, 4900, 4901, 4902, and 4905, and to repeal BPC sections 4843.5 and 4844.
Thank you for that. I just wanted to do a couple items. One mainly for clarification for Ms. Orlowski. There wasn't an in-depth summary of 4827, and that's because the board had already approved that legislative proposal at their prior meeting. So we didn't go through that again, just in case you were wondering where that came from. And then the other part in the memo, we had talked about how the stakeholders had asked the board to consider not limiting it to humane societies and animal shelters, and instead extend it to nonprofits. There was a request from the shelter community, or a potential suggestion is to mirror it after Food and Ag Code 30503.5, which defines animal shelters to mean public animal control agency or shelter, society for the prevention of cruelty to animals shelter, humane society, shelter, or rescue group. And then rescue group is defined as means for-profit or not-for-profit entity or collaboration of individuals that removes dogs from a public animal control agency or shelter, society for the prevention of cruelty to animal shelter or humane shelter, or rehomes a dog that has been previously owned by any other person other than the original breeder of that dog. The subcommittee did not make recommendations regarding that request. They are concerned about potential unintended consequences and the openness that may bring, but wants the board to consider that request carefully and decide whether or not we want to change as currently written, which is the animal control shelter or humane society.
First, I fully support this and encourage its adoption. The second part would be the unintended consequences. I think it's incumbent upon this board to look at what could happen. So I did have a review done of the California law, and I can rename my clinic the Tomlinson Equine and Shelter. And if I receive one dog that is unwanted and rehome it, I now meet the California standards for a shelter. And so I think that's an unintended consequence. And we don't want every veterinary hospital in the state becoming a shelter. So we need to tighten that up somehow with a definition.
Okay, Dr. Bradbury.
So the request for discussion about opening up for nonprofits. So I don't love the CDFA, was it the CDFA definition? It seems very dog specific. And uh, I, I I guess I was looking at this with the retired volunteer status. I think that's what we're, not the shelter veterinarian, but the retired volunteer status, or is it for both? Okay. So for the retired volunteer status, I was I know that there's like concerns that this is, I guess, going to be abused by some nonprofits to have retired volunteer veterinarians, but wouldn't we, like, if it's a veterinarian doing work, I guess we want them to get veterinary care and we want to support that. And then, when I retire, I may want to go volunteer at a wildlife rehabilitation center. And what about those types of rescues and rehabilitation centers? That's not addressed here. This is all very specific to dogs and cats and dogs, it sounds like. But I love all of this, but I guess I don't share the huge concerns about allowing a veterinarian to do work at a nonprofit. So I just, if that could be explained to me, what the concerns and the unintended consequences are, I just want to hear what they are.
It doesn't have to be a nonprofit. Anybody who calls himself a shelter, it applies to.
I'm talking about your comment and concern is different than what I'm talking about. I think I'm talking about adding in the wording of a nonprofit. So it sounds like people can call it a shelter, but we're talking about rescues and nonprofits. It's a different than, like, the way this is worded. Your hospital could do that. The question that also was on the table is whether they're to include a definition in the term nonprofit as to allow retired volunteers and I guess shelter veterinarians to do work at these rescues. So it's a different. I know you're looking. I may not be explaining it right. Maybe somebody else can explain it differently.
Somebody help us.
I think, yeah, you're talking about two different things, and I understand both of you. And I think I would say first to Dr. Tomlinson, I understand what you're saying, and I get we do need to look at unintended consequences, but your concern is that everybody could just rename their hospital a shelter. And I would say, yes, I understand what you're saying. I get it. However, I think that most veterinary hospitals are not going to rename their hospital shelter. And I get that that's not logical, but we have to look at it. I don't think that, I truly don't believe that that's going to be a huge concern. I think that yes, it can be, but I don't think that that's something we have to. I think we can look at it and we can say, yes, it's a possibility, but I think we're going to be okay. As to Dr. Bradbury, what she's saying is an unintended consequence of doctors looking at are working at these facilities. So is that an unintended consequence of having all of these retirees working at shelters and rescues? I mean, then, do we need to be concerned about this? And she wants to know, are there unintended consequences of these doctors working at these
No.
facilities, right?
No.
Oh, okay, that's
No.
what I understood.
No, what I'd like to know, so right now, I like the way this is all written, but the stakeholders had raised the question and the ask of, can we also add nonprofit or yes, nonprofit organizations as rescues. So that was not included in this because of a concern for unintended consequences of allowing this extra license population to now practice at extending it beyond the defined shelter in Humane Society. And I'm asking, what is that concern about these nonprofits? Why are we not including that? Because I could see a benefit from that.
I apologize. I used rescue instead of nonprofit, and I
Dr. Tomlinson?
Um, my issue with not just this change, but we want to do a lot of things to allow shelters to do things that are exceptions to our rules. But nowhere do we define what a shelter is except Food and Ag, the Corp Code 15502, and the California Code of Regulations 2030.6. Those places define it. But what I'm saying is anybody who wants to be a shelter can be a shelter. And because of that, we need to tighten that up if we're going to have any exceptions. In the past, it meant nothing. Nobody would want to do this. There was no incentive. We are now putting incentive in for people to do this.
Okay, Christy.
Yeah, is there a reason we don't have, and this is why I asked yesterday about Humane Society, is there a reason we don't define the difference between shelter, Humane Society, rescue, nonprofit? I know we've talked about this before, but why do we not define these so that when, and I see somebody's hand being raised like urgently in the public comment for public comment on this, but why do we not? I mean, I'm sure there's probably a legal reason, but I just am curious.
Mayor Mitchell?
Thank you. Yeah, I'm not sure I understand what the advantage is if we do this and someone declares themselves a shelter, because we're allowing retired vets to work for free. So how does that, I'm confused. And also on the topic of the nonprofits, there's a lot of organizations that work with humane societies and shelters that would really benefit. I agree with you that I think this is a huge benefit to that we want to make sure that they can be included. I know of two just in my county alone that are doing amazing work and need to work with other groups from the veterinarian perspective. So to me, this seems like, I don't understand the unintended consequences either of what you're suggesting. Why would you want to switch to a shelter? What's the benefit to that from this?
Dr. Bradbury?
So I think probably to answer Ms. Pulowski's question, I would say that this is a moving target that continues to change over time. And so making very specific definitions can be challenging, but probably should be done in some way. And then as the exception, the discussion of making these exceptions, I feel like we maybe are not making exceptions, but expanding our view on things as the profession and the landscape changes, and recognizing that there are these very different practices. And I think we're going to have to probably continue to do this over time. It's, when the Practice Act was written, veterinary medicine was very different. And we now have these just a very different landscape. So I think if we maybe rethink about it in a way that isn't like, oh, we're making exceptions for these people. It's like, actually, we're changing the law to reflect the current status of things in the state.
And what about the nonprofits that work with shelters? They work together, they contract with the shelters, and I mean, it's like there's still a nonprofit that owns the animal but works with the shelter and has all the work. So then how do we, I think we're getting into a tangled web.
And what about the wildlife people? I know this wasn't about them, but if we're doing this, I really feel like, I'm sorry, I feel like that's part of the the deal.
Yes, Dr. Tomlinson.
And really, my point is, I want this to pass. We need this. But we're not being very clear in, does it include this one? Does it not include that one? Should they just change their name in order to be included? I want us to not put out nebulous laws. I want people to understand what we meant and not have to go back and figure it out.
And that's why I'm asking for definitions too, is like, I want everybody included. I think it's important because I agree with you, Dr. Bradbury, in that we want to help as many pets as possible for the consumer because we do have a problem right now and we need to be able to help them. And so how do we make sure that this can happen? And so that's why I do agree. Like, why are we drawing a line?
Okay, Dr. Tomlinson. Go ahead.
Last thing that I would want to say is it sounds like we're in agreement that this isn't a big exception. Why are we limiting it so closely and then not defining who we're limiting it to? And so I would say we should open the gates up further rather than being nebulous about who we're limiting it to. I couldn't hear that. Okay.
Jessica?
So just a couple points. One, there was questions about why all these different settings aren't defined. And if it's not in our Practice Act, there's no reason to have a definition that's not in our Practice Act. So we don't mention rescue groups. There's not a definition for rescue groups. Where this came from was in the exemptions under 4827(4), where that's where the shelter community had put in an exemption to the Practice Act, and it refers to an employee of animal control shelter. It does have agencies or humane society. And then there's another provision in there that refers to impounded by a shelter not registered with the board, and then does a definition of shelter, but that doesn't entirely help because it says means animal control agency or shelter, society for prevention or cruelty of animals, or humane society shelter that is not registered with the board. So that part would it match? But that's just where this came from. And so I think to your concern about anybody can call themselves a shelter, that would currently exist under this current law. So if someone was trying to be exempt from the act, they likely would take advantage of this current law versus the other, the retired or volunteer. But I think your point's taken. I think with all this feedback, because it sounds like there's a consensus that the board supports the legislation, but are concerned about the lack of a definition of the groups, but also it sounds like the board is more for adding the ability for extending it to nonprofits. Is that?
I think so. Yeah.
Okay, so we could take that feedback to all of the stakeholders and continue to work on it, but I think it would still be good to get hopefully support for this legislation and a motion for it.
I'll make a motion to support this legislation.
I had one question on the retired status. They mentioned that there's a fee for that. Is that a one-time fee, or would that be a recurring annual fee?
No, so retired status would be a one-time fee, and that's just to help with the maintenance of processing the application itself. But then there's no fee after that. It's just retired. If they want to restore it, there's going to be a restoration fee because there's work tied to that, but that's it.
And the benefit that flows from retired status is you're just not identified as expired license or the canceled license.
Or delinquent, yeah, exactly.
Thank you.
So
Earlier, you referenced that some of the stakeholders were requesting that the board change or open up the retired volunteer and shelter license to the definitions, the animal shelters defined under the Food and Ag Code 30503.5. So animal shelter defined under that statute means a public animal control agency or shelter, Society for the Prevention of Cruelty to Animals shelter, Humane Society shelter, or rescue group. Then rescue group is defined to mean a for-profit or not-for-profit entity or a collaboration of individuals that removes dogs from a public animal control agency or shelter society, et cetera. I just want to caution if this moves forward and there's, authority of the executive committee, perhaps you want to give direction to the executive committee about whether or not rescue groups using this definition are acceptable.
I think I did say that I didn't like that definition. So I would say we should come up with perhaps a different and or just say the shelter humane society. We could use those definitions, and then for not-for-profit organizations that provide medical care for animals or something of that nature.
Whoever advised Food and Ag did it very well, because right above that, it says, this is for this section only and does not apply anywhere else in any of the rules. So we need to say the same thing on top of ours and then put a succinct definition.
Anybody else?
So just to clarify, the motion is to submit to the California State Legislature the attached legislative proposal to add BPP sections 4846.3, 4846.4, and 4848.2, amend BP sections 4827, 4858, 4858.1, 4858.2, 4900, 4901, 4902, and 4905, and repeal BPC sections 4843.5 and 4844. And then I have Dr. Bradbury making the motion and, I'm sorry, Dr. Thompson Dr. Bradbury make the motion and Dr. Thompson second. Thank you.
Okay. Now we open the agenda item for public comment for folks in the room. I see none. Moderator, could we open up the line for those participating on WebEx?
WebEx is now open for public comment on 5C as in Charlie. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a moment longer to see if we have a request for public comment.
We need a break.
Seeing no requests, you wish to continue with the agenda?
Yes, please. Actually, we would like to take a 10-minute break. Oh, we have to vote on the motion first, after we vote. Sorry. Yes.
Keith?
Yes.
Dr. Bradbury?
Yes.
Mr. Espinoza? Dr. Maniak?
Yes.
Mayor Mitchell? Ms. Orlowski?
Yes.
Dr. Tomlinson?
Yes.
Solicitor?
Yes.
Carries.
Now we can take a 10-minute break. So we will be back by 11:38? 11:40. That's 12 minutes. Okay, so we are going to continue with agenda item 6 to be presented by, oh, Tara has something to say.
I just wanted to clarify or correct a statement I made under agenda item 5B. The discussion I'm referring to was about the legislative proposal to amend BPC section 4826.6, subdivision I on page 9 being changed to new subdivision H. And on page 10, the legislative proposal would remove paragraph 7 with respect to the veterinarian shall submit a prescription to a pharmacy that the client chooses. I just wanted to correct my statement. The legislative proposal actually moves paragraph 7 to new paragraph 2. So that issue would remain in this VCPR proposal. And to the extent it changed the board members' consideration of that vote they just did to approve it, I wanted to raise this issue, but also remind you that the MDC has been tasked with reviewing the record review issue. And this is the concern that was raised by Dr. Miller for the MDC to include review of that issue. So most likely your vote is fine because this is going to be reviewed. I just wanted to make this comment to be very clear, especially for the other co-sponsors of the bill, that this one pharmacy issue will remain in this legislative proposal.
All right, thank you, Tara. Now we move on to agenda item 6. Go ahead, Justin.
Okay, item 6A, priority legislation for board consideration. Beginning on page 1, we list two-year bills that this board has seen and voted on. Last year, voted to oppose both bills. AB 1458 pertains to animal physical therapy. SB 687, beginning on page 3, pertains to animal chiropractic practitioners. Summaries of both of those bills as they stand as of now are provided within the memo. Additionally, we have provided board concerns for each of these bills just to indicate why this board opposed those bills last year. With regard to AB 1458, the board opposed this bill due to various concerns, including the lack of an education or clinical training verification requirement prior to a licensed physical therapist's practice of animal physical therapy on an animal patient. The board also had concerns with the bill's creation of new definitions of direct and indirect supervision that would conflict with existing definitions and the disparate approaches between this bill and SB 687. An additional concern was that this bill, AB 1458, would authorize animal physical therapy to be performed at a location that is not a registered veterinary premises. As such, it appeared that human and animal patients could be treated in the same room without the location conforming to any minimum standards of cleanliness or patient safety. With regard to SB 687, the board expressed concerns related to a chiropractor's familiarity with animal conditions and the lack of any veterinarian supervision. The board also believed that existing provisions allowing animal chiropractors to provide services under direct supervision of a veterinarian is sufficient. While the bill offers, as currently written, more consumer protection than AB 1458 by requiring a board oversight and certification, the underlying concerns regarding supervision parallel AB 1458. So at the time the board voted to oppose these bills last year, we were preparing position statements, but at that time we were notified that these bills would likely undergo significant revisions going forward this year. So no official position letters were submitted at that time. So with that, I'll ask Jessica if she has any additional updates she'd like to share. No? Okay. Any questions regarding those two bills? We're good? Okay, moving on to agenda item 6B. This is a staff recommended cleanup proposal, beginning on pages 4 through page 6. If approved, this proposal would make minor technical revisions and is intended to be submitted to the Senate Committee on Business Professions and Economic Development for inclusion in their cleanup bill this year. So summaries of the proposed changes along with the rationale for each change are provided on pages 4 through 6. The actual proposed text is provided to you as attachment 1. So in short, the proposed changes do things like add California to the board's name title, strike some statutory provisions for the reasons provided in the memo, updates a statutory reference, and repeals statutes that are no longer needed. And there is an action requested there, but I'll again ask Jessica if you have any additional updates.
The only thing I really wanted to bring up is the conflicts that currently exist with BPC Section 801 and BPC Section 802. 801 historically refers to those the reporting requirements for professional liability insurers to report malpractice settlements over a certain monetary threshold. At the same time that was added in 1975, I believe, there was 802 that was written with it, and the intent was for those without insurance. And then over time, because there's so many the healing arts boards that are in it, they would amend certain sections without cross-referencing and making a similar amendment to the other one. And then now we have a conflict when it comes to the Board of Registered Nursing Sunset Bill, and it talks about it adds adds a definition of insurer. And it created a lot of confusion, and we have an attorney trying to make an argument that 802 does not apply to veterinarians. One, because 802 refers to personal liability, personal injury, and you don't have personal injury when it comes to an animal patient, which I don't think would ever win in court, but they're welcome to try right now. But the other one is that 801 only applies because you have that talks about the definition of insurer and says, well, that clearly then applies. 801 specifically calls out the California Veterinary Medical Board and has a threshold of $10,000, where in 802 it's $3,000, and then you have some carve outs there. When looking at 802, the reason why I didn't propose changing 802 at this point is because I think that there needs to be a bigger conversation with all of the healing arts boards and this board as far as that threshold. Because when you look at 802, you have two subsets that are essentially identical in verbiage, but when you have a 3,000 threshold and one's 10,000 threshold, and that 3,000 threshold hasn't been changed since it was originally written in 1975. And $3,000 is not a lot, especially today. And so a lot of the rationale for these boards that are creating that carve out for that 10,000 is because 3,000 is so low that you end up getting all of these complaints, and you looking at it and that there's actually not any substandard of care. Oftentimes the insurance companies just settles for 3,000. And so they're spending a lot of time and resources on these complaints that may not need to be there. But I think that there needs to be a more holistic view in all of the reporting requirements and fix it together, but that's a much bigger effort. And so I tabled that one. But then when I did talk to the other healing arts boards and DCA Legal that were there was a recommendation at the very least to strike out that definition of insurer, that subdivision, because it doesn't make sense for the section itself, and it conflicts with 802. So I just wanted to clarify.
So we need this motion here, correct?
Yes.
Okay, so I will make a motion to submit to the California State Legislature the attached legislative proposal to amend BPC Section 130.801, 4839.5, and 4840.6, and repeal BPC Sections 4840.9, 4841.4, and 4842.
I second the motion.
Now we open it up for public comment. Agenda item 6B.
B.
Yes, B for boy.
Agenda item 6B. For folks in the room, any public comment? I see none. So moderator, could you please open it up on WebEx for public comment on agenda item 6B?
WebEx is taking public comment on the motion. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a few seconds now to see if we have a request for public comment. Seeing no request, you wish to continue with the motion?
Yes, thank you. So now we proceed.
Let's vote.
Oh, we proceed to voting. That's what I was going to say.
Ms. Pulaski,
Yes.
Dr. Bradbury.
Yes.
Mr. Espinoza,
Yes.
Dr. Maniak,
Yes.
Mayor Mitchell,
Yes.
Orlowski,
Yes.
Dr. Tomlinson,
Yes.
Dr. Solicito.
Yes.
Motion carries. Thank you.
Okay. Now we go to agenda item 6C.
Yes.
Go ahead.
So 6C, other potential 2026 legislation. Beginning on page 6, there are two legislative proposals that are being presented to the board. The board's being asked for feedback on these proposals. The first one at the bottom of page 6 deals with continuing education for pro bono spay and neuter services. This is a California Animal Welfare Association, Cal Animals proposal. The proposal is actually provided as attachment 2. So just a quick summary. Currently, veterinarians need 36 hours of CE at renewal. RVTs need 20 hours of CE at registration renewal. Under existing law, they can earn a limited number of hours through self-study courses and pro bono spay neuter services, but these are capped at a combined total. So 6 hours for veterinarians, 4 hours for RVTs. This proposal would remove that combined cap and allow separate limits. So for veterinarians, up to 6 hours self-study and 4 hours of spay neuter. That would make up 10 hours of the 36 total. For RVTs, up to 4 hours self-study and 2 hours spay neuter. And that would be the 6 hours of 20. Additionally, it would replace pro bono, the term pro bono, with at no cost to shelters, meaning CE credit applies even if the provider is paid by a third party, as long as the shelter rescue group is not charged. Additionally, this would clarify that the intent is to incentivize spay neuter services without financial burden on shelters. So that is the first proposal being presented for consideration or feedback. So I'll pause there.
Any comments from the board with the proposal with regards to the CE hours?
Well, I actually, I mean, I'll just comment that I like it. I think it, I like the combination of it. And I think that, yeah, I hope to see where this goes and we'll see.
I will have to echo that the continuing education for pro bono spay and neuter services is something that we probably could, it's like an initiative for veterinarians to be engaged in all the spay and neuter efforts. And hopefully they will be able to work closely with their local shelters. Oh.
So, and the sponsors, we don't need a formal motion. They just wanted to get some informal feedback from the board on the thoughts and the direction of this. A couple things, it's no longer pro bono. It's going to be at no cost to the shelter. So they might be charging for the clients might be charged for it because it's at no cost to the shelters. And the veterinarians might still be charged. And then it's noted in the memo that when the board was initially looking at when this was put in, there was a concern that this doesn't go to the intent of what continuing education is for, because they're providing services that they already know how to do. And so there was a concern that this is outside of the scope of what the intent of CE does. They were at the time okay with that though, because it was capped at that 6 hours of self-study. But I think the sponsors are concerned that if you have a competition between reading an article for 6 hours versus volunteering your time, then there's no incentive to actually do it. Why would you do that? Why would you do the 4 hours if you can read an article and get 6 hours? So I think that's the concern.
Boring just reading, you know?
Well, it's also, I mean, in my mind as an attorney, if I didn't work for the state, well, I also would have to get CE credits. And part of this is it appropriate to get CE credits for something you're getting paid to do? So that's what this proposal would do, is it would change it from pro bono veterinary services to potentially paid services, plus you're getting your CE credit. That seemed a little strange. But so I just wanted to highlight that portion of this.
I understand that. I guess my thought is that we're still talking about who it's for. I think is, again, we're trying to encourage people, or trying to encourage the care for the animals, and making sure that we are taking care of, pet overpopulation. And so I think that's where we're looking at this. And so if it gets people out there, that's what we need to do. And yeah, the problem is everything is offered virtually now. And so the hands-on just isn't becoming as popular. And if we can get people off the couch and go and help out in these situations, I think that's where we need to be able to encourage. And I'm all in favor of it.
The reality is a lot of people want to do this on-site, hands-on, practical, activities which they could earn CE credits for. But it's also about honing their skills. And I think just adding this extra layer of, hey, you could earn CE on top of you kind of like honing your skills, as long as the shelters have a good structure for it, because it always boils down to having a good mentor, for them to do it. I guess this is a good, direction to go to.
This brings back the definition of shelter, just saying.
No, that's fine. It's just informal feedback. I do want to thank Cal Animals and Carpta for the next proposal, because this is very early on in the stages. They don't have an author yet, but they wanted to work with us as early as possible to get feedback and to make sure it's successful, which they don't typically do. So I really appreciate that they sought the feedback so early on and were willing to give us a copy of the unbacked language before it's introduced to get that feedback. So I really thank Cat Animals and Carpta for doing that. Yep.
Yes. So moving on to the second proposal on page 7. So this pertains to RVT scope of practice. CARPT is seeking feedback on this proposal, which is provided as attachment 3. This would establish new provisions for an RVT to expand their scope of practice as a veterinary technician specialist, VTS. The summary of the proposal is provided on pages 8 and 9, but in short, this proposal would create a definition for VTS, create requirements for a VTS. It would identify prohibited titles, address veterinarian liability. It would also outline the scope of practice for a VTS, which would include items like authorized actions, prohibited actions, supervision, anesthesia, induction, record keeping, etc. Again, it's all summarized on pages 8 and 9. In addition, the legislative proposal adds the ability for RVTs without supervision of a veterinarian to administer or apply oral topical subcutaneous injectable medications or medical devices to an animal following a written prescription from a non-supervising veterinarian outside of a registered veterinary premises. Board staff notes there are many technical improvement opportunities throughout the legislative proposal. Those improvements aside, however, most of the VTS section could be accomplished via a regulatory proposal. However, that could be a longer process. The board has previously expressed its support to expand RVT utilization throughout the veterinary profession, and this proposal seeks to do that. In addition, the board previously discussed the potential for RVTs to administer medications without board supervision, but it was determined that that would require a legislative change, best sponsored by a professional association. So with that, I'll pause again.
Okay, so as a specialist working with various VTS RVTs, and also, I guess, on the AAVSB, having some exposure to expansion of veterinary licensed veterinary technician tasks. I have a kind of I don't know, just say I have a lot of different views about this. I think I like the idea of expanding things and allowing these very highly trained individuals to potentially do more. So I'm not against that. I have very strong concerns with this idea of indirect supervision for patients that are coming to specialists who are typically more critically ill than just a puppy or a young dog coming in for a spay. This idea that these patients would be coming to a facility that may not have a veterinarian on staff, that an RVT would be examining the patient to determine whether they are okay for anesthesia. They'd be talking to a veterinarian, at least it's the way I'm reading this, is that they would be talking to a veterinarian who would be maybe advising them and creating a drug protocol, but then they would be administering the anesthesia, monitoring the anesthesia, doing an MRI, doing a CT, placing a peg tube, possibly placing a chest tube, esophagostomy tube, et cetera, without a veterinarian being there. So the idea of having not having a veterinarian in the premises overseeing things if there were an anesthetic event or a medical complication is highly concerning to me. Expanding the scope of what they can potentially do with a veterinarian being in the premise, I think is reasonable. And when I was going over this at the AAVSB meetings, when we were talking about this, initially I had some pretty strong concerns about like placing a chest tube, having, an RVT place a chest tube, placing esophagostomy tubes, et cetera. But I had the opportunity there to have a really good conversation with a VTS RVT in North Carolina who worked at North Carolina State and regularly did some of these things and actually taught the veterinary students how to do that. So that actually really did help me feel more comfortable with expanding the scope of practice. It's the supervision here that really concerns me. And the other thing I just want to say is I really love the last part. Where is it? Where it allows RVTs to administer medications from a non-supervising veterinarian, which would allow people to hire an RVT to come in and help them at their home. And I think that that's super important and great. So I think that the idea is the idea is good, but I'm very concerned with the supervision. I also just want to say that this is supposed to be to improve access to care. And we all know that access to care is mostly about financial constraints with people. I know that in the veterinary specialty community, at least in this area, it is not as impacted in terms of being so busy that people can't get in. So that's not how it was like during COVID. And these procedures and these services where VTS are involved are usually quite expensive. And while we would love to think that the cost savings to the people who own the clinic would be passed on to the consumers, I think it's naive to believe that would happen. That's my spiel.
I didn't read that. First of all, the sedation anesthesia, it says to perform a secondary physical exam. They'd act as an authorized agent to act as an agent for the supervising veterinarian to perform a secondary physical exam. So I read that as not the initial, they were not going to be acting as a primary person for anesthesia.
So my interpretation is that VCPR has been established by a veterinarian at some point. And then like how I saw this being enacted is they would go to this place. A veterinarian doesn't necessarily have to be there. They just has the RVT. Why would they need to perform that exam if the veterinarian's there?
Yeah, so I think that I was very pleased, obviously, as an RVT to see something like this, and I took it as this, they're bringing it forward to us to have these conversations and have open dialogue, because it is very clear that we need to be having scope of practice conversations, because if we don't, then this is again going to happen with or without us. And I would rather be sitting at the table and having these conversations. And so I don't want to be Colorado. And and I'm coming to you as I'm not a VTS. So this is not going to affect me, but it's going to affect me in a big scheme of things. So it is going to affect, and I don't read this as an access to care, because I think that's unfortunately that's become a buzz phrase that everybody uses to make it important. And access to care is a real issue, and it's being, compromised because everybody wants it to be their buzzword and make it important. But access to care is a real issue, and we need to make sure that we use it correctly and appropriately. And anytime we say we involve, and this is no offense to any specialist in the room, but specialists are not an access to care issue. And anytime we bring that up, it's like they need their vaccines. They need to be seen and examined. They need basic preventive care, and sometimes they just need to be seen. So that's the real issue. And so handling pet overpopulation, that's an access to care issue. So I just look at this and I say, thank you for bringing it to us and having us sit at the table and have these conversations. Yes, there are some very big concerns in this language, and I would love for us to have it. I do agree that some of it is the supervision. I'm with Dr. Bradbury on that. I want to make sure that we have the proper supervision, but I also want to make sure that we acknowledge that they have gone through extensive training and they've done a lot. And I want to make sure that California can help VTS use their knowledge, skills, and the requirements that they need to maintain that VTS are extensive. And we need to make sure that California allows them to continue getting their licensure and not make sure that these VTS go to other states because they can't even get there and continue it. And again, making sure that we're promoting scope of practice for RVTs, because if we don't do it, somebody else is going to come in and do it.
Okay, we start with Dr. Maniak.
I mean, I think that was perfect what you said. If we don't address this, if we don't get RVTs, the scope of practice, we're going to be Colorado. We're going to deal with this. So basically, it comes down to take your pick. We either boost our RVTs, which I think is the answer to a lot of issues. We're going to have a lot of issues that we talk about today in the shelters. If we have the vets all of a sudden, their time freed up to perform spays and neuters, rather than having to write 100 medical records per day, then we don't have that issue as much of some of the things that we're talking about today. That's just in the shelters. General practice, it opens up, I mean, one of the big things today is even general practice. I know specialty is extremely expensive for the consumers, but general practice is now becoming outrageously expensive. If we can have wellness care and basic level of medicine practiced by RVTs, indirectly supervised, that does improve access to care because now we don't have as much of the financial burden as they are going through today.
Completely agree. Step one, I trust my RVT. I do not trust a PA. So I do not want to be Colorado and have a new level. Really support this because of that. I think these are the people we've trusted for decades. Let's help them have the next step. The one thing as a business owner, I want everybody here to understand, when I read this, my first thought is, wow, I need to start opening up wellness clinics with VTS in charge at 10 satellites in the community. I'll be in one place and I can oversee them from there. So where are we going with this needs to be thought before we actually do it.
One of the things that I have a question about is the VTS, as it says here, would be defined as an RVT who holds membership in a specialty organization. I guess my question, how many specialty organizations are there? And also, would it serve like the need that we're thinking about, like, having kind of like a mid-level practitioner? Or is this something just is pure specialty, but then now we're creating an elite group of RVTs, but is not really serving the general population. So that's kind of like where I'm at, because I don't know. Just like in veterinary medicine, we have like the college of feline practitioners, or is that the same with the RVTs? I don't know. So yes, Dr. Bradbury.
So I don't know all of them. I know there's internal medicine, there's surgery, there's, I believe, anesthesiology, I believe there's critical care. I want to say there's a nutrition one, but so this is specific to VTS. So this would not help with what you guys were hoping for. And these procedures are very specific that they're allowing for that would, I don't think that most people in general practice are placing thoracotomy tubes. They're not placing PEG tubes. They're not doing MRIs, CTs. Okay, an ultrasound, yes. What I would want to ask all of you is, would you want your mom to bring her 13-year-old male neutered Cocker Spaniel that has, mitral valve disease that is still compensated and chronic kidney disease and diabetes to come in for an MRI, or let's say a CT since it takes longer, a CT of its abdomen, and have an RVT that is specialty trained, do the exam instead of the doctor, do the secondary exam, decide whether that patient is okay to go through anesthesia, then monitor anesthesia, and when that patient has an event under anesthesia, call the doctor and have that person assess it over the phone and make adjustments. So that's what we're talking about. And I also looked at this as a business owner and said, man, I can open up those imaging centers that I've always thought about. This would be amazing. But then I, dialed it back and thought, well, this isn't the best thing for these patients to not have a veterinarian available. I think that the VTS RVTs, I think that this is appropriate for them, the list of tasks that they would be available or allowed to do, which would be different than what RVTs are allowed to do now. I think that's totally appropriate, but I just feel like this idea that a veterinarian doesn't have to be at the premise to handle an emergency for these critical patients, not necessarily critical, but usually more sick, it's critical care, it's anesthesia. I mean, you know what I'm saying? It's like, it's not, and not that they wouldn't do a good job, but would we want to have our family members bring their animals in and have that happen?
I just think that this is a great opportunity for us to look into this, and I am glad that Carta had brought it to the board for feedback, and that's exactly what is being asked, right? So we do have our concerns. We see that this is more like a specialty, definition. Even if it says RVT scope of practice, it's not. It's RVT specialized scope of practice because it doesn't apply to all RVTs, right? So I guess that's where we're going to go, try to give that feedback to CARTA about what our concerns are. Yes, Dr. Maniak.
I'd like to strike my comments for this section of our discussion because I look at, so for specialty care, I agree with you wholeheartedly that it should be direct supervision for specialty care. I'm talking about non-specialty care. That's where I'm going with RVT, and that's probably for us to discuss in future discussions.
Dr. Tomlinson?
Mine also is more for wellness care rather than specialty care, but I see this expanding. I don't see this as static. I think as soon as people see this, they're going to go, well, add this and add this and add this and add this. And I want them to know we see that. The other thing is supervision is great because you call them up, I see this, and they supervise. When everything hits the fan and the dog is dying in front of you, you don't want to be on a phone. You want to be focused on the dog. So there's a big difference between supervision and not in the building.
I just will say that, first of all, I think you guys might be shocked that I can't remember, and Stephen may be able to correct us, 13 or 17 specialties. So they wanted our feedback. I think that was what was important. And, we shouldn't get stuck on ER or wellness, or because it encompasses everything. And I think that's the biggest thing, is that they just we're getting stuck in one general area, and there are so many specialties. So we can't say, well, this doesn't work for this and it does for this. We have to look at the whole picture. And that's why I think it's so important to say we need to give a general feedback. And we have concerns about supervision.
Yeah. Can I just say one last thing? I just want to say my comments really, it's not to be negative towards this at all. I am also very grateful that we have the ability to even discuss it and give our feedback. And the way I go about discussing things sometimes sounds very negative, and I apologize for that if that's how it came off. But I just I feel strongly about it, obviously, because this is actually very specific, Christy. So the way this is written is very specific about various procedures and whether there's the type of supervision. So while we're having this kind of general discussion, this language is I think very specific. So anyway, I do really appreciate being able to talk, and hopefully, and maybe when we have public comment, there can be an explanation for why that level of supervision was chosen.
Just really quickly, yes, this is specific, but to me, this type of thing is our future. So we need to start thinking about this now, start moving it forward.
I just want to make a clarification, because it sounds like the most of the concerns are related to the VTS section, but the last section about RVTs being able to apply the medications on their own without the supervision, it sounds like there's support for that. Okay, thank you.
Good. So now we go on to public comment on this agenda item. Anybody in the room, please? Yes.
So this will be
We're hoping that you would come up.
for both proposals, so the cow animal proposal and the carp dip proposal.
Okay. Oh, can you press the light at the bottom? There you go.
Good afternoon, board. I'm Steven Stahl from CARFTA. Thank you for looking at this. I love the feedback. This has been so good. Christy, there are 16 academies and there are 27 different specialties out there. And we actually do have some peer-reviewed data on the average applicant for VTS, which is an RVT or credentialed veterinary technician that has been in practice for at least 10 to 11 years before they start to apply. And depending on the academy, it's anywhere between a 3 and a 5-year long application period. So it's very extensive. I think all the feedback is really good. I really appreciate it. I want to push back against a couple of things. The supervision, we put minimum supervision is indirect supervision. If that veterinarian with that VTS would like to tighten that level of supervision, it is fully within their purview to do so. So, I think the supervision thing is a very reasonable concern. And then the anesthesia one specifically, if we go back to statute as far as what is good practice of anesthesia, that physical exam needs to be done within 12 hours of that procedure. So we're hopefully catching those cases within that period of time. So, at my practice, we're a specialty neurology practice, say our MRI is down, I can send it down to animal scan and have a VTS do that instead of animal scan specifically. Used to hire anesthesiologists to do all of their cases, which adds a significant fee to the consumer. As far as it being tied to specialty procedures in particular, there actually is they're one of the faster growing specialties, which is clinical practice, which is for general practitioners. And specifically, we put these procedures in there for large animal because we do have some friends in Arkansas that has a much more ambitious, already passed law that allows a VTS to go out, establish a temporary VCPR, and do many procedures that are much more broad than what we see here. And then as you mentioned, Colorado has a mid-level practitioner, which we are trying to avoid. And there are conversations happening about that in California right now. So, oh my God. Colorado also passed a very similar bill that allows VTSs to have an increased scope of practice at indirect supervision. So that's kind of where this came from. And South Carolina also did that as well. And Washington to an extent, but that is Washington's change is more so for any credentialed veterinary technicians. Thank you.
That's helpful.
Thank you very much. Anybody else? Okay, Dr. Miller.
Hi, Grant Miller, California Veterinary Medical Association. CVMA officially has no position on this bill, but the CVMA does have a general position that only veterinarians should diagnose, prescribe, and perform surgery. And this bill is trying to allow VTSs to do all three of those things. So while I can't tell you definitively that we're against it, I have a pretty good feeling where we're going to go. One primary concern with our previous discussion about VTSs is that while there is no doubt that they have extensive education and very impressive education, their educations are largely divergent. And you can have a VTS that has a behavior specialty or nutrition specialty who has no training in taking a skin biopsy, which is surgical training. And their specialty training in some of their tracks is largely self-study. It's still impressive. There's no one that doubts that it's remarkable training, but the training isn't uniform and universal across all VTSs. So that's one concern. And And again, any attempt, doesn't matter which specialty, any attempt for them to diagnose, prescribe, prognose, or perform surgery is going to be met with opposition by us, because we believe that those things require the totality of a veterinary education to be able to safely and competently perform. Please note that the skin biopsy, if that is allowed, will be in direct conflict with your legislation that you are sponsoring in 5C, which defines now surgery as incising tissue generally. We also have concerns about RVTs owning their own businesses, which is what Section E would do. We would need to have a premises permit for them. They would need their own separate minimum standards, which means a pretty large workload for this group. I can't say that the CVMA is opposed to it, but we think that it will be a very heavy lift in allowing that type of structure to occur. Again, not necessarily opposed, but it will take a lot of conversation and a lot of work. Remember that AB 516 just passed this year, which is an affirmative statement that says if an RVT or an assistant is not doing something otherwise prohibited by law, it's already allowed for them to do. So when we're talking about we have to go there, we have to get there, we are there. RVTs have a tremendous amount of capability in doing things in practice that we underutilize them for now. In AB 516 by Assemblymember Cowra, sponsored by the CVMA, was an affirmative statement that
15
said
seconds.
not diagnosing, prescribing, and performing surgery, and it's not otherwise prohibited for an assistant under RVT restrictions, then they can do it. So ultrasound, they can already do it. No, nothing prohibits that. It's just like taking radiographs, same idea. And
Time.
a final reminder, just because somebody sponsors VTS legislation does not mean we're not going to have MLP legislation here. So this is no safeguard to us not fighting the MLP battle. Thank you.
All right, thank you. Are there any other comments from the room? I see none. Moderator, could you open up the line for our WebEx participants?
WebEx, now is the time to raise your hand. You can do so by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take a few more seconds to see if we have any online requests for public comment. Seeing no request, you wish to continue?
Yes, thank you. I see it's already 12:28, so we will pause here for a lunch break, and we will be back by 1:30.
I
Oh,
don't
there's
know
a
if we need
comment,
to do
okay.
this, but we didn't take public comment on, correct.
No, we did ask that the public comment was open for both.
We did? Okay,
Yeah. Unless there's people who wants to comment.
okay.
If you
Sorry,
guys missed it.
I only heard it for the legislative proposal.
Yeah, we added both of them for the public comment. Okay. All right, so we will go on recess and be back at 1:30. Thank you, everyone.
Okay, okay. She corrected it. Usually you guys do, but I didn't hear it. Sorry. She corrected it early because I said A.
Okay, good afternoon. Welcome to the afternoon session, and we will start the meeting with agenda item 7. Go ahead, Justin.
Yes, thank you. Agenda item 7A, status on pending regulations. So the two main updates for this item are that I'm happy to report that we've had 2 rulemaking packages approved since the last meeting. So number 1, our minimum standards for alternate veterinary premises package, which is discussed on pages 1 and 2. And then on page 3, our drug compounding package as well. So just a brief update on each one. So since the October meeting, at the October meeting, the board approved modified text for the alternate premises package. That modified text was in response to some issues that OAL had pointed out to us while they were doing their final review. They identified what they deemed as a couple of clarity issues. So we addressed those through the modified text. The board approved that, as I mentioned, in October. We noticed the text for 15 days that began on October 17th, ended on November 3rd. The board received 1 inquiry and 1 public comment during that 15-day period. The inquiry was not adverse. The public comment did not pertain to the modified text, so no additional modifications to the text were necessary. On November 12th, the final rulemaking package was resubmitted to OAL, and after review, it was ultimately approved on December 29th and filed with the Office of the Secretary of State on the same date. The approved regulations took effect on January 1, and they are now posted on our approved regulations webpage. As you may recall, we also had the Title 24 amendments that had been approved in late 2024. Those also are effective as of January 1. And then on to drug compounding. Just a brief update here. Let's see, where do I start here? So that 45-day public comment period concluded on November 3rd. We received 1 inquiry and 3 comments. During that comment period, the items were not adverse. We responded to the commenters. There was 1 comment, the final one, that was suggesting a minor technical change to the text. We did entertain that, but it was ultimately determined that it wasn't necessary. I don't think it changed the way we would enforce the regulations. However, we might entertain that as a non-substantive change down the road. On November 24th, the DCA director approved that final rulemaking package. On November 25th, it was submitted to OAL and was ultimately, the package was approved on Monday, January 12th, filed with the Secretary of State on the same date. And those regulations are also available on our approved regulations page. So I just wanted to also thank Jessica and our regulations counsel, Elizabeth, for kind of seeing that one through or to the finish line. I happened to be out on that date, so thank you both. Did you have any comments on either one? No? Okay. So that leaves us with 4 remaining pending packages here listed on pages 4 through the end of the memo. We recently submitted our 2026 rulemaking calendar to OAL, so we've kind of calendared these 4 remaining packages and are kind of setting internal target dates to get the documentation finalized and through the review process. So just in short, item number 3, our records proposal, we're going to try to put that on the same track as item 6. Item 6 is more non-substantive changes, so we're going to try to put those on the same track. And then after that, we would be processing the civil penalties package shortly after that, and then ultimately the RVT registration pathways package, which is item 5 on page 5. So I think that concludes. And then, as always, as the attachment, that spreadsheet just shows any updates or changes in the status of the pending regulations in red text since the last meeting. So those are my updates unless there are any questions.
Does anybody have any comments, questions? All right, I guess we open it up for public comment for agenda item 7A and B, including A, B.
Yeah, just to clarify, 7B was put on in case we needed to make changes to the text. And since OAL came back with their approval, we don't need to discuss 7B.
Oh, okay.
So this is just about public comment for 7A.
Okay, so public comment for agenda item 7A from the room. Looks like there's none. Moderator, could you open up the line on WebEx?
WebEx is open for public comment on 7A. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a few seconds to see if we have a request for public comment. Seeing no request, you wish to continue?
Yes, please, thank you. Okay, thank you so much, Justin. And now we're moving on to agenda item 8, which is going to be a presentation by Dr. Bradbury. Report.
I'm like,
A
oh,
report. Yeah.
well, can you pull up the PowerPoint? Hi. So I don't have anything formally prepared. I think I'm just supposed to give an update with my experience on the with the AAVSB Board of Directors and anything kind of that might affect us here. We did have a meeting in November, an in-person meeting, which was I think it was 3 days long, including some training, some board member training, which was super helpful. We also did some strategic planning, and I just learned a little bit more of how that board functions, and it was pretty eye-opening in that this is the only board I've ever served on, which is a regulatory board. It's a very specific function, and there's a lot of rules that go along with it. While this organization is actually a business, it's a nonprofit business, but it's a business and is such because of that. It's run differently, and and that's some of why they don't have the same structure where we always have public comment here. We post our agenda, we post all of our meeting material, and that's not required. And I think even from the legal team, sometimes not advised as a business. So I'm learning that side of things, which again is new to me. But it did help me to understand some of the reasoning behind the kind of the what it seems like a lack of transparency it did prior to getting onto the board. And I don't know that that's the intent. It doesn't seem like that's the intent at all. Working with these folks, it's a really good group on this new board. It's myself and 2 other new members, and we have a new president who had reached out, Tim Kolb. He reached out to me prior to the meeting and encouraged me to ask questions and participate, which I obliged him. I know that surprises you all, but in any case, they really did encourage participation, and I really have enjoyed meeting all of the folks at the AAVSB. It's a really good group of people who I think really do have the best intentions to follow the purpose that's been laid out in front of them. I think the other interesting thing that I learned in the kind of the way they define the board of directors is that it's a strategic board, which I had to look up as to what that means. but that also is different than an operational board. So we're, not supposed to be kind of in the nitty gritty of things. But at the same time, we are ultimately the responsible individuals for the course of the company, for lack of a better term for it. And so, to me, that's going to be a little bit of a balancing act in trying to understand like where, what crosses that line and what doesn't. And so, that's where a lot of questions come in. But they are a strategic board, and their whole, the mission and the goal is to look forward and see what's coming down the line for veterinary medicine. And I think that's where some of the topics have come up. The VPA, the telemedicine, those sorts of things, where I think at least my perception of how this has gone is that they see that as something that's in the future and really here, and is going the profession and the regulatory bodies will be faced with these issues. And so it behooves us as a board of directors to try and address them ahead of time, kind of like what we were talking about with the discussion over the VTS legislation. Like, this is here, it's coming. So, as a strategic board looking into the future, we really do need to try and get our arms around it, early. So I feel like I have a lot better understanding of where some of that, some of those things came from and why they were happening. So a lot of our discussions in November were related to really trying to encourage member participation. We have a few boards, including our own, that participate all the time, and we love that. But there's a lot that we don't get a lot of participation from, and so there was a lot of discussion on how to improve that. And we spent a day really thinking about how to do that, as well as how to improve trust from the members to of the board of directors and of the organization. We've talked about some of the bylaws, the changes, and there have been some changes that at this point I don't think are going to make a big difference in terms of submitting proposed resolutions or bylaws changes. But there was some concern based on the way that the resolutions were written. At the last meeting, there were some resolutions that were brought to the floor by a member board that were unanimously, not unanimously, but by a vast majority passed with a lot of support. But the way they were worded and how they were presented was a concern. And so the board of directors was really wanted to prevent a similar situation, and instead would like to work with member boards when these are being drafted to try and improve how they're written so that they are more accurate and more in line with sort of how the bylaws are written, et cetera. But the new, I think it's part of the bylaws that was passed by the board, encourages people to work with the bylaws committee and get the feedback. But if ultimately there's no agreement, they still can bring it to the floor. So anyway, that was kind of one of the big things that was discussed. We also are working on for race providers. There's some issues with race providers not submitting proof of CE completion in a timely manner. And so that's limiting renewals, or not limiting, but holding up renewals, and has been a challenge for regulatory bodies as well as licensees. So we are working on trying to pass, I think we just did actually at our last meeting, new rules that require a certain time limit for them to submit the proof of attendance, and then some penalties if they aren't complying. So that was I think a important change that happened. Other than that, they are meeting again in a couple, I think 2 weeks, which I will be missing. But after that, I'll be able to attend all of their meetings. And we have monthly meetings that are a couple hours, which you all are welcome to participate in. Well, not participate, I should say you can listen to and attend. And then we have another in-person meeting in June, and then we'll have the annual conference. So that'll be in Providence, Rhode Island. So yeah, if anybody has any questions, happy to.
I guess that's it. Oh,
I would just like to say thank you for the reminder about associations because, you know, I've worked with and for a local association for 30 years. And it's very true that they have a different model and we forget that sometimes sitting on a board. And so it's very different the way minutes are taken and everything is taken. So I appreciate that reminder to us. So thank you for bringing us back, grounding us.
does anybody have any comments or all right, well, thank you so much, Dr. Bradbury. Now we're moving on to the next agenda item, which is the student liaison reports.
Nope, sorry. So we still have 8B and C. So 8B is a call
Oh.
for bylaws amendments. They do this every year, and this is typically the time that our board weighs in on bylaw amendments. However, AAVSB's bylaws and resolutions committee is doing a whole revamp of their bylaws. And so I think instead of proposing any bylaw amendments this time that may conflict with what they're doing, let's wait to see what they're going to do. And then after they've done their whole overhaul, then we can look at revising after that. So I don't think there's any pressing ones that we need to discuss, but it's still there if anyone has any burning requests to change their bylaws. There's also a call for nominations. They do have some positions that are open. You have the president-elect position, you have the treasurer position, director positions. There's 3 positions for 2-year terms as a director, which what Dr. Bradbury serves currently. There's a position for the nominating committee member, and there's a position for AAVSB representative to the ICVA, and that's a licensed veterinarian position. So I just wanted to throw those out there in case there's anyone interested or any nominations. And if not, that's also.
I would say if anybody's willing to be on the nominating committee, that's a really important committee. Not that all of them are important, but we would love that.
You guys,
Any,
do we have anybody that we would like to be nominated or the nominating committee? Volunteer?
Dr.
I would,
Thomason.
I would volunteer for the nominating committee. I've read the requirements and I meet those, but then how many times have you been to the annual meeting is one of the key questions.
Yeah, thank you for that. I was going to say that there was a one where we had nominated Dr. Solicito to be on the nominating committee, but because there was a requirement that they attend at least one annual conference, she wasn't eligible. So because Dr. Thomason hasn't attended an annual conference, he wouldn't be eligible for a nominating committee.
Yeah. And also, I'm already a member of the bylaws committee, so I won't. So we need somebody who has attended.
I think Miss Pulowski.
I think Ms. Pulowski, yes. Yeah,
Would absolutely take it if that's it.
there you go.
Oh, sorry. I would absolutely take it, but yes, I've been to an annual conference.
There we go. So we have a nominee for the nominating committee member. That would be our RVT board member, Ms. Pulowski.
And Jessica, can you look and make sure it's not like limited to a doctor?
No, that's what
So
I,
it doesn't say, which I don't think that there is, because the AVSB representative does say it has to be a licensed veterinarian. This one doesn't say that. It just says one position with a 2-year term.
yeah, that's what I was looking for too, and I didn't see.
Well, I want to make a motion to nominate Miss Christy Pulowski for the nominating committee.
Public comment.
Now we open it up for public comment. For anybody in the room, any public comments? I see none. So moderator, could we please open it up on WebEx?
WebEx is
Sorry, this would be for public comment for all of the agenda item, not just the motions, just so we can capture it all at once.
all right. Public comment is now open for the item, for the nominations and the entire item of agenda, the entirety of agenda item 8. Please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a few more seconds to see if we have a request for public comment. Seeing no requests, do you wish to continue with the nominations?
Yes, please.
Ms. Pulowski,
Yes.
Dr. Bradbury,
Yes.
Mr. Espinoza,
Yes.
Dr. Benyak,
Yes.
Mayor Mitchell,
Yes.
Dr. Lowski,
Yes.
Dr. Tomlinson,
Yes.
Dr. Solacito,
Yes.
motion carries.
All right, now we move on to agenda item 9, which is our student liaison reports. I understand that our UC Davis liaison, Sebastian Lidike, will not be able to join us, but he had sent in his report to Jessica, and Jessica will be presenting it.
So he did send it to me last night, so I do have it. And then, but if we can go to Anna first and let her give her report, and then I can read Sebastian's.
Okay, so moderator, can we please have Ms. Stiles be able to present?
All right. We have Ms. Stiles available. You should be able to unmute at will.
Hello, one second. Let me just get my video up here. Okay. Can everyone see and hear me?
Yes, we can.
Perfect. Well, good afternoon, members of the board. My report will be a little bit on the shorter side for this quarter's with the holiday break and everything. Things kind of slowed down. And yet still lots has been happening. So as I've mentioned in my previous reports, the Humane Society and Shelter Veterinarian chapters, like student chapters at Western U, put on these Street Dog Coalition clinics every 6 months. And they're a major highlight of our college in my eyes. They work together to provide free basic veterinary care for pets belonging to people experiencing housing insecurity. And we also, in recent years, have worked with human health professional students from other colleges at Western U to essentially help with the human caretakers for these pets as well. And this past fall's clinic provided care for 48 dogs and cats, which is one of the bigger amounts of patients that we've seen. And the organizers of the event, the student organizers, attributed this to the clinic's consistency, since it happens every 6 months, and there's that reliability, as well as successful community outreach and word of mouth. So I'm doing my part with word of mouth. And we have lots of new faculty this year. The newest addition being Dr. Jonathan Cox, who has joined as Assistant Professor of Foundation Sciences and Coordinator of Educational Engagement and Innovation. His work is going to focus on supporting faculty with teaching strategies and furthering educational research. And then Doctors Alcaraz and Peralta, they stepped down as faculty members. They joined in 2007, and they had been crucial to the development of the college and the students. I can't sum up how like influential they have been to so many students, myself included, in this report, but I wanted to mention their departure, not only because students are certainly feeling, sad about the departure, but I would say overall grateful for the chance to learn with them. But I also want to just highlight the significance of compassionate leaders and mentors in veterinary education. And this applies both on and off campus. The people we interact with can really shape how we approach animal health and veterinary medicine. And I think Western U students, especially, even though it is student-centered learning, at the same time, we learn how to make connections and like kind of build support around us and figure out who we can go to, because we all need to go to people for one thing or another at some point. So even though we're obviously sad to see them go, um, it also kind of gives us a moment to affirm how grateful we are and how important this is to us. And then another aspect of student engagement that I just wanted to highlight was our One Health Day Symposium, which happened in November. It happens every year, and this year there were nearly 80 people in attendance, and we had speakers from the Veterinary College, UC Riverside, Cal Poly Pomona, and Pitzer College. These speakers presented their research and discussed how their work relates to this year's theme of food and One Health. And there were also attendees from a diverse background, including students from Western U's College of Optometry and graduate nursing, as well as from 5 other colleges and universities in the region. So this is just to highlight, there are students and faculty that organize this event, and they really do a good job and understand the importance of collaboration in the kind of pursuit of One Health. And so students at our college are particularly attuned to that concept and engaged with it outside of the classroom as well. So overall, I'm impressed by my classmates and their ability to stay focused and engaged amidst, we have faculty changes, we have difficult external pressures, both locally and globally. And so I'm just impressed with their ability to not just put their head down and in their books, but still engage with things around them. And that concludes my student liaison report. So thank you very much. I'm happy to answer any questions.
Thank you so much, Anna, for your report. And I echo your, comment about your classmates, your schoolmates, about just putting in all the work and making sure that they're still not just focusing on studies, but being engaged in what is happening in I guess, globally. Does anybody have any comments, questions for Anna? All right, so I guess we're moving on to the UC Davis report.
All right, so this is from Sebastian, and this is in an outline format, so it might be a little confusing, but I'll do my best. So the first one is AI Scribe implementation in VMTH, which I don't know what that's.
Veterinary Medical Teaching Hospital.
Oh, thank you. Thank you. UC Davis VMTH is implementing ScribbleVet, and he provided a link so I can send this out to the members so you have it. There's a comment here that AI Scribe used to create soaps through audio recording. Clients able to opt out of recording / audio analysis. And then his third comment on this item, is that it's unclear to what extent students are currently being encouraged to use this tool. There's an article that states it's being implemented across all facilities, but I imagine many services will hesitate to allow students to use it during rotations. The second item he has is that they have open recruitment for new Associate Dean Professional Education, and there's a link here that you all will have access to. This individual will report directly to the dean, involved in managing DVM curriculum, supporting students/faculty/staff in development of curriculum, and helps with oversight of educational facilities/equipment. Number 3 is new information available regarding UC Davis SVM Limitless Expansion Campaign, recently updated web pages. SVM. Thank you. Veterinary Education Pavilion expected to assist with goal of increasing capacity for veterinary students by 33% and for residents by 35%. Primary Care Hospital will serve as a center for expanded primary care services as opposed to current primary care services offered at the VMTH. We'll have an urgent care center. Small Animal Hospital, apparently a direct or adjacent expansion of the VMTH, intended to expand capacity for small animal caseload by 50% per year. Large Animal Hospital includes an equine rehabilitation center, enhancements to equine surgical center, and equine theriogenealogy center. Veterinary Cancer Center focused on translation research with collaboration from UC Davis NCI.
National Cancer Institute.
Thank you. Comprehensive Cancer Center, Spay and Neuter Clinic. This is a fun game. Stated goal of teaching both vet students and practicing veterinarians how to spay and neuter for the purposes of reducing overpopulation in impacted areas still seems to align with SB 1233. And there's no new information on the Raptor Center facilities. Dr. Watrina Smith is the new executive director of the One Health Institute, with a 5-year term. Dr. Michael Zaccardi was the previous executive director, but he has since moved to a position at the separate wildlife facility. Dr. Smith holds a DVM and MPVM and a PhD. Dr. Jessica Morgan is the new Associate Director of Center for Equine Health, 5-year term, currently Associate Professor of Equine Field Service and Department of Medicine and Epidemiology, and was recently Service Chief for Equine Field Service at the VMTH. No news since AVMA COE accreditation site visit. I have no reason to expect the school to change in accreditation status, and that is it. Yeah, thank you. Thank you for that educational opportunity for me. If you have any questions, I can send them to him.
Any comment? Okay, Dr. Bradbury has a comment.
Start typing. No, I just wanted to say that I use ScribbleVet myself. So it's interesting that they're using it there. I find it to be very helpful, but I have to reread everything and adjust things pretty much on every report. So I'm sure that they are doing that also. But anyway, thank you.
Didn't we discuss this? I know that I know what it was. AVMA had their policy on AI. And so were we going to?
It was the AAVSB.
I mean, the
think.
AAVSB, that's what it was. The AAVSB had their policy, but we didn't do anything about.
There was a presentation, Beth put on a
Right.
presentation, and then we actually, I'm sorry, I had a very poor report from the AAVSB, but that is one of the, something we're doing this year is Beth has put together a task force on looking at further into AI and regulations as well. So
I would say my comment would be, I'm glad that UC Davis is already taking this on and making this as a part of the trainings of the young future veterinarians, because AI is available out there. And the best thing that can be done is for them to be able to adopt it under the guidance of, good mentors, making sure that the tool is not going to impact the quality of medicine that they're going to, you know, practice. So go Davis, UC Davis.
Can I say one more thing?
Okay, good.
I just wanted to say, Anna, I really do love your reports. I didn't say anything before, but thank you so much for always coming on and for your compassion and just I look forward to your reports.
Anybody else? Okay. All right. Thank you so much, Anna. I'll see you in 3 months. Okay. And then we're moving on to, public comment for agenda item 9, the student liaison reports. Anybody in the room would like to make a public comment? I see none. So moderator, could we please open WebEx for those online?
WebEx is taking public comment on agenda item 9. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a moment now to see if we have a request for public comment. Seeing no request, do you wish to continue with the agenda?
Yes, please. All right. Okay, the next item would be, item 10, the board president report. There's not much that I could report because it's been pretty slow and because of the holidays. However, I just wanted to share that we did join in, listening in to the discussions with the shelter stakeholders with regards to the licenses that we were discussing earlier. And, both Christy and I joined in just to make sure that we are, aware of how conversations are going. And so that, and then also AAVSB, I became a part of the bylaws committee. And I would have to say, what I've noticed is that there is a conscious effort in making sure that trust in the board or in the AAVSB is, I guess, maintained. I don't know if that has been an issue before, but it's been part of the conversations. And the bylaws committee is in the process of rewriting some of the bylaws, but we've had 2 meetings with 2 member boards, Kentucky and West Virginia, because they submitted proposals ahead of time, and those are being considered, and we were, listening in to the rationale behind their proposal. I guess, as Jessica had said, the committee just didn't want redundancy, so they're encouraging the member boards to work with the committee even before, like the actual annual meeting. So I'm learning a lot, I'm staying quiet, but because I'm listening, and so far, I would say it's been very good meetings that I've been to. And then the regular exec team, we do have our phone calls with Jessica, who is always, making sure that we're apprised of what's going on with like legislation or like stakeholder activities or even staff issues. And the last thing that I did was before this meeting was to help onboard our new board member. And that's it. That is my report. Public comment. Now I open it up for public comment in the room. No public comment in the room, so our moderator, can we please open up WebEx for folks online?
WebEx is once again open for public comment. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a moment now to see if we have a request for public comment. Seeing no request, you wish to continue with the agenda?
Yes, please. Thank you. Now we're moving on to agenda item 11, the RVT report.
Okay, so I'm going to just report on some VT&E things that have been happening and then a little bit of AAVSB stuff. So our next VT&E committee meeting is coming up on January 30th. As a follow-up from our last meeting, we are currently trying to establish some criteria, and this is going to sound really jumbled, but it does make sense, in order to review current tests so that the VT&E committee members are providing objective and consistent feedback that aligns with the job analysis, and which will also allow the job analysis task force to review and consider our feedback in a more meaningful way. So basically, when we're reviewing questions in the test, it's allowing us all to be more aligned. That's going on currently, and hopefully will be resolved before the January 30th meeting, or we may continue at that meeting. On January 7th, AAVSB met with ABTE and CVTA to continue discussions from October and review the gaps between the VT&E task analysis and CVTA accreditation standards. They all felt it was a productive collaborative conversation, which allowed them to identify several areas for further exploration. So they've released a joint statement, which I'm going to read because it actually is, it kind of talks about all of the things that we've been talking about with the job task analysis and the VT&E. So in October 2025, leaders from the Association of Veterinary Technician Educators, the American Association of Veterinary State Boards, and the American Veterinary Medical Association convened in person to discuss strengthening the future of veterinary technician education, credentialing, and support systems across the profession. Last week, the work continued during the Veterinary Leadership Conference in Chicago, where we welcomed the new leadership of the National Association of Veterinary Technicians in America, so that's NAVTA, into the conversation as an important voice in this growing effort. At our initial meeting in October, we were encouraged by the spirit of openness, optimism, and shared responsibility that shaped the discussion. That same energy was evident again in Chicago, where we took meaningful initial steps in a joint effort to assess how CVTA accreditation standards align with the VT&E job task analysis. Working alongside volunteer leaders and staff from AVMA's CVTA and team, we conducted a full crosswalk between the accreditation standards and job task analysis. In the process, our expanded team identified areas between the job task analysis and accreditation requirements that warrant further research. This research may reveal a gap, or it may show that there is not. Our organizations are committed to conducting this research through the AVMA convention this summer in Anaheim, where we will reconvene in person to review the findings and discuss potential next steps. Additional outcomes from the second meeting included an update on AAVSB's technology review, which will be shared separately with the ABTE community. Exploration of potential joint research initiatives focused on increasing understanding of the VT&E, student success, and broader technician utilization. Initial planning for in-person fireside chats at each organization's upcoming conference, where we will take the stage together to share progress today, invite open dialogue, and continue this shared walk forward. While organizations each have unique responsibilities, we are united in our commitment to transparency, continuous improvement, and the well-being of students, professionals, and the public. This was a productive and energizing meeting. We left Chicago confident that while the path forward may be complex, the steps ahead will bring us closer and benefit the communities we serve. We must also recognize that collaboration requires listening, compromise, and trust. No organization or individual will get everything they hope for, but we continue to find strength in our shared willingness to lean in, learn together, and stay focused on the greater good. In that spirit, we reaffirm our shared commitment to ABTE's guiding principle of one community, to work in partnership, respect each organization's role, and support the systems that serve veterinary technician education with care and integrity. Our work continues, and we remain committed to keeping our communities informed as we move forward together. So I would hope from this that the VT&E committee will be able to move forward with some of our requests as well. So that's it for my report.
Does anybody have any comments or questions for Christy from the board members? No, none. Okay, we've opened it up for public comment for those in the room. Nothing. There's none. So moderator, can we open it up for the people participating on WebEx for item number 11? Yes.
WebEx is taking public comment for item 11. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a few seconds to see if we have a request for public comment. Seeing no requests, you wish to continue with the agenda?
Yes, please. Thank you. Now we're moving on to discuss agenda item 12, which are our executive management reports, starting with Matt.
Thanks, Dr. Salcido. Hello, board members. All right, so the admin report, we have a few staff updates for you. Bryce Solaski was one of our enforcement analysts who accepted a position with the Division of Investigation previously. We've backfilled the position with one of our enforcement technicians, Macy Ingalls. She's been part of the team for quite some time now, and she's taken on some projects like Public Records Acts and processing complaints and inquiries from stakeholders. So we're excited to see Macy moving up with the board. Kelly Fairless also is back with the team. She was previously a member of the board's licensing unit, but she's now going to be an enforcement analyst on the enforcement unit. Alicia Hernandez also accepted a position with the Department of Water Resources, so she's no longer the board's admin and licensing manager. We do wish her the best in her career endeavors, though. And then Philip Wilcom was the board's special investigator who was hired in January of 2025. He recently accepted a position with the Fair Political Policies Commission as a special investigator. And I just want to thank Philip for his time with the board. He played a pivotal role in helping to establish some of the practices and procedures as a time as special investigator. And then lastly, we have we filled the admin and licensing manager position with one of our current employees, Andrea Maya Torres. She was in the enforcement unit at the time, but she's been with the board since 2018, and she's previously worked in the licensing unit, so she has some experience there with all the different license types and applications, and we're just excited to see her growing with the board as well. We also have updates on some of the training that staff took during last quarter. And usually we have like an update where we've collaborated with Solid on a all staff training, and we're going to continue that through 2026. I'm actually meeting with the Solid's training unit manager on Monday to look at the dates for 2026 trainings, and we'll schedule them throughout the year quarterly. Moving on to the budget. In the revenue projection report, it demonstrates the board's collected approximately $3,858,000 of the budgeted $8,883,000 in revenue. The current expenditure projection shows the board's projected to exceed its budget by about $605,000 this year. This is due to some increased costs in administrative hearings and Office of Attorney General costs. So, and I just want to explain a little bit there. The board has been transmitting some of its largest, most complex cases to the Attorney General's office over the last fiscal year. That's resulted in cases going to hearing, and one case in particular lasted several months. So to offset that, we're going to look at pursuing a budget augmentation to offset those line items. And these projections also don't take into account that the board's recently gained authority to enter into stipulated settlements with licensees prior to transmitting them to the Attorney General's office. So we expect to see some significant cost savings there on AG and OH costs during FY 25-26 as we develop that process. The fund condition shows the board anticipates to conclude the fiscal year with 11.5 months in reserve, which would be 11.5 months to operate without collecting additional revenue. The budget team is also, assisting as always with making sure the board submits budget change proposals or, just addresses any kind of imbalances in the budget as they come up. So if there are any questions on the budget, we also have the budget team online to help out with that. I don't know if we want to do questions at the end of each report or get to the end of the reports and go for questions. So. Okay. All right, cool. I asked them to stay online, so in case there's questions at the end, they should still be able to help out with that. So moving on to 12B, I'm also presenting that one to you all. We have some updates there from the examination vendors, ICVA and the AAVSB. I think I wanted to point out the NAVLE retake policies being updated, and ICVA also provided a statement on like an independent audit they're going to conduct on the NAVLE. AAVSB had updates mostly on their annual conference from 2025, and I wanted to congratulate Dr. Bradbury on her appointment to director at the event. They also provided some updates on a new bill that's going to allow individuals to pay possibly for VTNE and licensure data that they're providing for participating boards or member boards. As far as licensing updates, we've received so far through the second quarter of this fiscal year, the boards received just slightly less applications than they had through the second quarter of the fiscal year last year. The number of veterinarian applications received saw no significant deviation. It was 300 this fiscal year through quarter two compared to 294 last year. The most significant reduction was in RVTs and VA CSPs, which we saw approximately 100 less of each type of application come in. The board also issued slightly less licenses through the second quarter of this fiscal year than they had last year, about 195. But again, comparing the individual license types, the board issued slightly more veterinarians and slightly more premises registrations, but slightly less RVTs and VA CSPs. So, and if we look at our pending applications, we have a total of 584 paid pending applications, or at the beginning of the fiscal year, there are 584 pending, and there's currently 579. And if we look at quarter two of FY 24-25, we've decreased the pending application workload by 227. The licensed population also continues to increase. So that's pretty much what we got for licensing.
Here, you can take the, Patty gets the middle seat.
Good afternoon. Okay, so we are here with presenting the enforcement report, and I'll go ahead and get us started. In November, we held a quarterly roundtable meeting for our inspectors. We discussed some issues with the mobile inspection application, as well as potential future enhancements. The release of the actual iOS application has been delayed a little bit. The user acceptance testing revealed some bugs that need to be fixed, so they're currently working on that. And some additional testing is going on. So as soon as that is concluded and everything works out, then they will release the actual application. So we continue working with the OIS and Tyler Technologies on that. And our ongoing efforts to recruit an inspector in the Bay Area have finally paid off with the hiring of Miss Sarah Hollinger. So she has degrees in criminal justice as well as veterinary technology. So she's a great addition to our inspection team. And she's already hit the ground running, has completed a couple of inspections, and has come up with she's got some great feedback and lots of questions. So she's been great. And she's currently a veterinary MRI tech at a practice in the Bay Area. So the Bay Area is now covered, so we're happy about that. Now moving on to intake. The intake staff they've continued to process complaints well below the 10-day cycle, so they've been able to maintain that consistently. Investigations are opened within about 4 days. And as previously mentioned, the intake staff, they were continuing to focus on requesting records for cases where the records hadn't been obtained yet. But so they were working on that, but by December, the number of cases pending at intake was just 2. Since one of our intake technicians have recently promoted, we may see a temporary rise in this number as we work to fill that vacant position. So we're working on that. Hope to have that position filled as soon as possible. So I'll turn it over to Rob for the rest of the report.
And I think that intake is probably still well under our 2 days,
Yeah.
even now with the vacancy. Investigations, it looks like where we are right now, so through December, we have a little bit more than pending cases than what we had at the end of the fiscal year, so July 1. But I think many of you already know we were doing a records request project. We wanted to basically for all of our cases request all the records, get them where they need to go in the consultant queue so that we could have more of a realistic idea of how many cases we were actually looking at, which required an expert or a consultant review. And we also had a couple of vacancies. So that's why we had a little, I guess it was a little bit more static when it comes to those. Let's see here. As far as the subject matter expert program, I think this was already reviewed more in detail during the MDC report earlier today, so I don't need to go over that. And then basically probation, we've got 26 complaints on 12 probationers. We've got 3 petitions for early term and then 1 petition for reinstatement. And then since the last board meeting, we had 5 licensees beginning probation, bringing us to 60, and then we've got 7 of those are tolling their probation. But I think that's it for the highlights since last time.
Well, we're happy to answer any questions. Dr. Bradbury?
Okay, so last year we were going at a rate where we were starting to close more cases than we were than we had. Like we were kind of starting to get ahead, and I think that's backed up a little bit. Is there any like estimation of how long it'll take to actually get a handle? Because I think last year we felt like we were getting a handle on things where we're able to keep up and not have, 3-year pending cases.
I wouldn't be able to take any guesses as far as when that would handle. I mean, I think over the past couple of years, we've cut into it a little bit, but even if we maintain that level of decrease, it would probably, I mean, if it stuck to that, it would be years before we would get back down to, get down to 0 pending, basically.
Right.
I just wanted to jump in at here because we were able to maintain it because we were closing more than we were receiving, but that receiving continues to increase year
Right.
after year. And it's increasing at a very high rate, but our staff doesn't do a proportional increase.
Right.
So there's going to get to a point where even with all of the efficiencies we have, unless we add more people to it, that increase is not, the increase keeps happening. So we're going to eventually still see that where we're no longer able to close as many as we're receiving. But I do want to emphasize, though, what was previously reported with having more consultants review cases and how we are able to close 65% of our standard of care cases without even having to go to a subject matter expert, which is really high. And so we're hoping that with that, we're able to soon see that come out in our statistics as far as closing more cases. I think it's just because this is a new implementation and we're starting to track the data to see what it's doing. But I am concerned, and we've communicated this with Department of Finance when it comes to asking for additional positions, that there's going to get to that point where even though these positions that we got a few years ago, we're able to close more cases because that cases received doesn't decrease, it continues increasing. We're going to still be back where we were with the backlog.
Right. And I'm sorry, this is like my never-ending conversation, but it still is, I think, important, and not to just, give up and say that, oh, well, this is how it is. And they're increasing. And so thank you for going to the Department of Finance. I think we have to also think of other ways to address, like, to continue to try and think outside the box. I know we only have 5 consultants. Is
Yeah,
there
I
a
was
way
going to say that
to
that might be a good idea if
to
we could get another
increase
one.
consultants?
Yep.
I mean, maybe more than just one. I don't know, is there a limit to how many we can have?
No.
And,
Mm-mm.
okay.
Yeah.
And then, I think that you're gonna be able to, they're not all going to the Attorney General anymore, so that'll be,
Huge.
helpful as well. But, I just would encourage us to continue to try and think of additional ways to tackle this.
Yeah.
Yeah, and we did add another consultant, and I'll have to find out how many she's averaging since she started. But typically, we want to make sure that they're well established and they know what's expected of them, because the consultants definitely they see a lot more cases than, let's say, an expert who sees, maybe one a month.
And we are constantly trying to, it's the more of the continuous improvement mindset, to where we're not going to be stagnant. We're continuously look for ways to improve every step of the process, and collaborate a lot with all the DCA boards as well, to see if there's any other way that we can do things more efficiently. So we're always looking for a way to improve.
I know this is probably the next step when Justin gets up here, but even a way to stop the complaints from coming in reaching the consumers themselves, doing some type of, we talk to the profession, but is there a way to do a webinar for the profession and how to communicate with your veterinarian? And I know that sounds horrible, but like just a way that we can, what's going on with the average complaint, that how do we talk to the both of them? And I don't know how to do that, because I don't know what the average complaint is, and I don't know, is there a way, what's happening? And so I don't know what the answer is, but I don't even know if that's a way to do that. And like,
Well, and I know one of our strat plan items is to focus on how to file a complaint and that portion of it.
yeah.
So, I mean, maybe tying into that, advising, I don't know, maybe
I'm not
the
telling them to
complainants of-
not complain.
Right,
That's not
exactly.
it all what I'm saying. Don't complain. That's not what I'm saying. And I want to make that clear. I'm not saying
Yeah.
don't complain.
Right. No, definitely not. But we don't get a lot of non-jurisdictional complaints that come in, but I think there are complaints that are right on the cusp. There's probably other opportunities too where there might have been a miscommunication and that complainant could have spoken directly to the veterinarian. So maybe putting a finer point on that in that the FAQ or the videos I think that we're going to do.
Yeah.
So that complainants can see that, or potential complainants, and go, oh, okay, I guess I should do this first. Or if they're talking about something that maybe isn't jurisdictional and they're trying to make it jurisdictional, maybe they're going to realize, okay, I'm going to try and go around this. And at the end of the day, it's not going to be something that's jurisdictional for the board.
Right. Because it just, it hurts everybody and time consuming. But I mean, that goes to the profession too. So
I had a question. What constitutes a level of complexity that requires a referral to the Attorney General's office? And how do you manage to decrease those type of cases?
It wouldn't be a level of complexity necessarily. I think it's just a level of consumer protection necessary. So if we send a case to the Attorney General's office, then we're going to take disciplinary action against their license. So if we see a complaint or a case that we've investigated or a group of cases, and it's necessary that we take action against the license to protect consumers, then that's when we would transmit it over to the Attorney General's office to take action. And then typically it's going to go through that process. Obviously, enforcement's goal is to take action at the lowest level possible. So if there's a way that a citation, let's say, which we can do basically internally unless they appeal it, if we can do that and that's going to satisfy that mandate of consumer protection, we're going to do that. So just because something can be transmitted to the Attorney General's office doesn't mean that we are going to do that. And if it's not warranted, then we shouldn't be doing that. So it's really only when it's necessary to protect consumers. And obviously, Dr. Bradbury kind of talked about that process and things that are changing there. So that could be that's another kind of opportunity.
I forgot what I was going to say.
You're not, okay.
I had just one more thing. Was it in our sunset where we uh, changed the prioritization of the prioritization of complaints where we went to what the standard DCA is, or did we never change that, or what happened there?
No, the only changes we made to the prioritization was we added, we basically struck all the different license types and we made it an individual, so we can now prioritize unlicensed practice complaints in it. But then we're leaving the prioritization how it is.
Can we leave it on the MDC's subcommittee kind of tasks to continue to meet and think about ways to streamline this process and just, I mean, that was part, when I was on the MDC subcommittee, we did that. I don't know if that's still on the, on the radar there. And so I don't know if everybody agrees, but this to me is really, it's our top priority.
I just want to make a comment. Looking at the numbers, yes, we would want it to be like a little better, but if we really are comparing how we've been doing with the investigation outcomes from the previous years and the first half of the fiscal year of 25-26, I am seeing like about 100 days less in the processing of the cases. And for me, that's pretty significant. I guess what maybe, the team can do is identifying why are we making this difference, right? And focus on, because it's a good change, So maybe focusing on the fact that how come we're doing this much difference. And what's significant, I was looking at this, the average number of days from receipt of the complaint to assignment to investigator, it's all 4, and then there's a 7 because of the holidays. It's December. So I would say, should we allow the holidays to impact, like this? So maybe having more proactive measures in place would still significantly lessen the processing of these cases. But I would have to say, I am seeing the improvement. For me, 100 days, that's 3 months less, This is definitely, do we want more? Of course, right? But I think just kind of like also recognizing the fact that we are making significant, progress. I just want to make sure that the team is also being acknowledged for that.
And when it comes to the days that you're mentioning, one of the other things that could factor into that too, that I think everybody should be aware of is, Jessica was talking about the consultant review process, and that can affect obviously the time frame, because if we're initially looking at cases that are younger, and we're not going through a process of we receive this case and it's this old and then we work it, and some of those newer cases, well, I guess quote unquote newer cases might be getting worked, that is going to affect that total number. So that's one of the other things that factors into it. So I would like for that average number of days to be a complete representation, or at least some representation, but there is definitely an asterisk there when it comes to the cases that we run into. Or if we run into groups of cases, and let's say we're working a case because one of them is several years old, but then they have several new cases and we close them all, then it's going to have an imbalance when you look at the average of that group of cases that gets closed. So that's, one of the things I certainly, would love to give credit to the enforcement team, but I also don't want to, misconstrue anything that comes across. And sometimes when it comes to the cases and how we're working them together, it's not always as easy as just seeing the number there and saying this is good or this is bad. But I think at the end of the day, one of the numbers that we're all aware of is what Dr. Bradbury was pointing out with that pending complaint backlog, and that's the big one, and that one is right there, and that's not going to lie. So that's definitely first, front and center to us, because it's always there, it's always looming, and we're doing what we can to chop away at it. But anytime there's an opportunity to kind of, change things up or examine, better ways to do things, we're more than, willing to do that, as long as it doesn't fly in the face of consumer protection.
Any other comments? Okay.
I think it's really hard when you have to deal with somebody that may have corrected a behavior before we're even disciplining them is kind of sometimes what it feels like, It's like, it's so far behind. And I think that's what I would say to your point. It's really hard. It's like, we're so backlogged.
Well,
And some of those cases are so old.
or they're so bad and they have multiple cases
Yes.
and they've lasted 3 years, 4 years, and they're
Right.
still
Which
practicing
is,
the whole
I
time.
don't want to go there because I didn't,
collecting
that's
cases.
egregious. That's just
So
like.
I just don't
Yeah,
know.
we're not getting to something that's really, really bad.
That's not protecting consumers.
Yes.
And I know you guys are working really hard, and I hope you know that I know that, and you have all these limitations with, in particular, just the number of people. But I just can't, go, okay, it's just not.
No,
in
no,
my
no, I
one
definitely
does.
understand.
That's not our,
one does.
yeah,
no,
that would be
we
horrible for us to
yeah.
just ignore.
And we're
these.
definitely not looking at those egregious cases, which is a lot of them, where people are continuing to practice because we get the calls from the complainants who are, I'll say, really upset because they say this person is still practicing. But we're not saying, okay, we know that these cases exist, but we're doing these ones which are maybe more low-hanging fruit or whatever it may be. We're also working the cases that are in a similar situation. And the unfortunate reality is, both of those cases, if you want to kind of categorize them that way, are that high priority, and we just don't have enough to take care of them at the same time. So of course, you're going to have to do one and not be able to do the other. And then one complainant is going to say, why is this person still practicing? And they're not going to know, well, this other one isn't, or we're taking action against this. And then of course, sometimes during that investigation, we might find out that something, looks really egregious and there's a lot of complaints and it gets our attention. We go through it and then we have an expert review it and they say, yeah, it's not as bad as as what you would think, or at least as bad as how the complainant is painting it. And they give you the 20 pages of the complaint and they're calling you constantly. And then they're upset because they say, you should have taken this person's license and put him in jail. And it's like, well, the expert went through it and, the standard of care, maybe there was a departure, maybe there wasn't. But either way, we kind of have to go through that process and figure it out.
All right, thank you. Any other comments from the board? None. I guess we're moving on to agenda item 12D for outreach. Thank you, guys.
Okay, item 12D, outreach report. This will be somewhat brief. A few of these items are from October, so they may be a bit dated, but they're here because they weren't fully captured in the October report. I know we've already discussed this, but the shelter stakeholder meeting was held on October 9th. The MDC Unlicensed Practice Subcommittee held this meeting with representatives from the shelter community to review a legislative proposal to amend BPC Section 4827. Again, the intent of the proposal is to prevent animal owners from performing surgery on their animals, with exceptions. And again, the subcommittee sought input from the shelter community on what other statutes and regulations they believed may hinder their ability to provide necessary services to the community and their animals. This proposal was included in the proposal that you saw earlier on the agenda. So that will be submitted to the California State Legislature. On October 10th, Dr. Solicito and Ms. Sieferman attended the CVMA's quarterly Board of Governors meeting in Monterey. They provided an overview of board activities since the last quarterly meeting and strongly emphasized the importance of recruiting more SMEs to review enforcement cases. In October, we distributed a monthly announcement to our email subscribers, informing them about the VMA presentation. On September 23rd, we included information on the September 23rd radiation safety webinar. There was also information about the October 1st board and Board of Pharmacy joint stakeholder meeting. Information about the October 9th Shelter Stakeholder Committee. We included a blurb about inspector and SME recruitment. Also, just an update about the October 10th Board of Governors meeting. Also in October, we posted a hyperlink to the board's radiation safety webinar that was held in September. So that link is available on our website. Also in October, we noticed modified text for the minimum standards for alternate veterinary premises rulemaking package. And again, as noted, that package was approved by OAL on December 29th. And those changes took effect January 1. Also in October, we distributed an announcement to our email subscribers informing them about CDFA's recruitment efforts to fill its division director position for the Animal Health and Food Safety Services Division in Sacramento County. And as mentioned earlier, Stephen Beam was selected for that position. On November 6th through the 8th, Ms. Sieferman observed the AAVSB's Board of Directors meeting. She also observed the Board of Directors meeting on January 13th. And did we provide an update on that one? Or Jessica?
Yeah,
did you
Dr.
want-
Bradbury already went over that.
Okay. And then in December, we distributed another monthly update to our email subscribers, informing them about Chapter 2025 legislation that the board was monitoring last year. We did another inspector and SME recruitment blurb, and then just provided the 2026 MDC and board meeting updates. Also yesterday, we distributed an announcement regarding the alternate premises regulations that were approved. And then we'll soon be sending out an update about the drug compounding regulations being approved by OAL as well. So that concludes my updates, unless there are any comments or questions.
I just had one other update. I am working on creating more outreach materials as it relates to the recent legislation that was passed. Specifically, our Sunset Bill had a lot of changes in there, so I'm developing outreach, and I'll be working with the outreach subcommittee to help vet some of that before we post it, but that'll be posted soon.
I have a question. With regards to our outreach, what is the means of us sending it out? Do we just post it on our website?
So we post it on our website. We have a list of subscribers that is pretty significant with all of our licensees and a lot of stakeholders that we send out. We also have our social media, which is X and Facebook, that we post out.
Okay.
We also, depending on what it is, we'll disseminate information to and from CDFA. Right now, I'm working with the Board of Pharmacy. They're helping develop some information for our licensees that will disseminate out. So we look at various ways to get the word out. We also send it to the associations to help disseminate information out as well.
Yeah, that's the reason why I'm asking, because it seems like not everybody knows. Like I kind of like had information that they thought that everything is just on the website. So there's a lot of different ways that we are trying to reach out, and I guess collaborating with local BMAs, sending out those information is going to be important as well. Okay, does anybody else have any comments? All right, so I guess we're moving on to agenda item 12E from Matt. Yeah. Thank you, Justin. I guess I just like.
Hello again. Just have a update for the strategic plan for you all. And just looking at like what we updated everyone on in October compared to where we're at in January. In October, we were 59% of objectives and 79% of tasks completed. And I think I reported there we were kind of stagnant for that period. Now we're up to 68% of the objectives and 83% of the tasks. So we've done some more work there. We also identified in the objective tracker that some of the tasks are what we categorize as on hold. And what that means that like they're being worked on, but some things are outside of the board's control. Like we're working with another agency or department who's not available to currently help us out with whatever aspect of that objective we need their collaboration for. So we just wanted to kind of identify like where we've worked on what we can and not, the things that I guess are out of our control. So when we look at the pie charts there, I feel like it's kind of like they're in the pending, but they're maybe closer to completed. So just wanted to kind of point it out so we can get a better idea of like what the board can do. Yeah, Christy.
I have a question about that. So I noticed that there's a few things that are like that are on hold. And so if you guys can't, if you can't do your videos, if you can't do those things that are on hold because you're waiting for somebody else, what do you do and how does that count against the board? And like, what happens with that?
So it's up to the board. So the board can decide to not pursue it. But as long as this is the direction of the board, then we'll continue to put it on and as soon as we're able to move it forward, we will. So it's up to the board if you want to carry it through.
There's many things that we're kind of in a holding pattern because of somebody else. And how long do we wait because you can't do them?
Yeah.
So, okay, I was just curious.
Well, and I think what we can do too is like with some of them that they're DCA entities in particular, we follow up with them and find out like if it's when we could expect they have the resource, then we'll follow up with them again. And I guess if we continue to report back to you like still on hold, then at that point, maybe you'd reconsider.
And just a reminder too, it is a 4-year plan, so we have time and we're well on our way to completing the plan. So early again. So I think there's no harm in putting it on hold until they can do it because it's still good ideas to do. We just are waiting.
We're just a bunch of overachievers, I guess. Right? So, but it's looking good. And maybe mid-year we'll be able to revisit again, and see what needs to be moved or changed or anything. Right. Yes, Dr. Tomlinson, go ahead.
Is there any way to, when we see something in the plan, to know a little more about it? Where would we find any additional information?
So it depends on what it is. We tried to put some bullets in on what we did to accomplish those specific objectives or tasks. Some of them, there may be some hyperlinks to additional information, but if not, then you can always reach out to me and I can give some more clarifying information. If you have any specific questions now, I can try to answer them, but I can always take them off and give more background information on them.
I was just looking at the 581. Why does it take a year and a half to do?
5.8, hold on, let me scroll down.
Down, 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 down.
So it's not so much that it takes a year and a half to do, it's more of, we have all of these tasks and objectives out there. And so we tried to put them on a calendar of when we're gonna do certain things and try to spread it out over the year. So it doesn't necessarily mean that it takes that long, it's just when we have the resources to put to them. But I do know that we can work with the equine practice subcommittee and try to get that done sooner. But that target completion was where we had all of these tasks and where we put it in the calendar. So, but the board can always change that and say, we want them to move that up in priority. That's just where it fell when we had all of these tasks. I do want to say though, the unlicensed practice subcommittee has met with the equine, a lot of equine practitioners and talked to them about developing outreach materials for horse shows and polo clubs and reported on that a couple meetings back, I think. So they're still working, the outreach committee that's one thing that they're working on next. They did the dog shows first and they're moving to the horse shows. So I think those are in progress, but it just wasn't on this year's to tackle. That doesn't mean we won't tackle it next because like I said, we're we're moving pretty quickly through the plan.
Jessica, to your point on that one, the 5.1 is where that is discussed, and it was the target completion date was Q1 2027, and we already have 2 entries for the outreach subcommittee meeting on those things. So it's
Oh, I thought he was talking about 5.8.
Oh, sorry.
Yeah.
Yeah, I just was going to say that this is where we would adjust the prioritization if we looked over the strategic plan and we were like, oh, a lot of these things are done. Why don't we move that up? I mean, you can make that recommendation now if you wanted, if you felt like that was more important. I think that's part of why we're doing this.
Yeah, I was just trying to understand what it is. So I hate to move something up if I have no idea what it's doing. So.
Yeah, don't move things up too fast because it's a
4-year plan.
Yeah.
Yeah.
No, it's okay if we get it done sooner. We just meet again and make a new strategic plan, which we did early last time too, which is great when we can do that.
And were your comments that it's already in progress correct for 5.8, or were you talking 5.1?
Well, she mentioned the unlicensed practice committee and taking on some of those tasks in 5.1, discuss the unlicensed practice committee and like going to dog shows. So I was kind of like, but I was pointing out that it was also like an objective that was identified as a Q1 2027 target completion date, but the board's already making progress on it. So we're not necessarily bound to wait until then either. We work on them as soon as we can, I think, on some of these
Yeah,
things.
it's listed as pending though, not in progress. So I just wanted
Yeah,
to.
they kind of overlap there, but yeah, there's some, I would say that there's some that we probably could have put in progress for 5.8 with those specific things because we have met with the equine community and the racetracks, horse shows, and the administrators of those events to.
Who's we?
I'm sorry, the unlicensed practice subcommittee started reaching out with them. And that was when Dr. Grant was also on that unlicensed practice subcommittee. And we talked to them about potentially having more of a presence at those horse shows and the polo clubs, and then also the outreach materials to develop, work with them as well. So I think that this probably could have said in progress.
Okay.
No more comments from the board. Okay, so I guess, thank you, Matt. We are going to open up agenda item 12, A, B, C, D, and E for public comments for the folks in the room, which I don't see any. Moderator, can you please open up agenda item 12, A, B, C, D, E for public comments for those on WebEx?
All right, WebEx participants, now is the time to raise a hand for agenda item 12. You can do so by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a few seconds to see if we have a request for public comment. Seeing no request, you wish to continue with the agenda?
Yes, please. Thank you. I guess we're moving on to agenda item 13, Jessica.
So we have future agenda items and next meeting dates, and we have some tasks that the MDC is still going to be working on to bring to future meeting, which is one of the biggest ones is separating the licensing manager from the premises registration, shifting the responsibility from the licensing manager to shifting responsibility of the standards, the minimum standards, to the premises registration owners. So it's a pretty big task that they'll be tackling. And then the other one is requiring electronic medical records with the reasonable transition periods. So that's another thing that the board had delegated to the MDC to research. April tends to be heavier on the legislation, so we expect that to be more in the next meeting. And then we have what I have from the discussion so far today is researching the concerns related to charging for written prescriptions and medical review as discussed today. And then they'll come back with potential recommendations. So those, what I have so far, all of the 2026 and 2027 meeting dates are online. Let me pull up just for the 2026 meeting dates. We have April 15th and 16th, July 15th and 16th, and then October 14th and 15th. And then if members, board members or members of the public have any other additional items, we're happy to add.
Are we doing nominations or interviews for MDC?
Oh, thank you. Yes. So
Thank
that
you.
would be, we'll be doing recruitment here by the end of this month for the vacant MDC meeting member positions that are coming up. And then April, the board will be reviewing those and interviewing those candidates and appointing for the hopes of them starting for the June meeting.
Okay. Dr. Maniak, go ahead.
Can we either discuss at a future date further the RVT scope of practice issue or pass that on to MDC to look into?
So typically, when it comes to scope of practice, those are things that the profession is best suited for legislation. The board participates in those discussions like we did today. We had told CARPTA when it came to the scope of practice that those are pieces of legislation that are done through the professional associations, and then we will help participate in those discussions with implementation or kind of concerns. So we continue with that, but the board itself doesn't typically engage in legislative proposals with scope of practice.
Dr. Bradbury?
I just, since I think in April, we're going to be talking more about the legislative packages. And I think the allied health professions are going to come up. And I think last time I had mentioned it would be great to have some data on if I don't know if you can get that, Jessica, through your EO meetings.
Yeah, so when I met with the different boards at the annual conference, there's only a couple that actually issue the allied health practitioner licenses. There's a handful of states that it's regulated by the other boards, so like the Board of Chiropractic Examiners and the physical therapy boards. So our executive directors that were there didn't have any of that information. Kentucky has not yet issued any registrations or licenses. It's a brand new thing, so there wouldn't be any data there. I have followed up a couple times with Nevada because they are the ones that have been issuing those certificates. She says that they do have information. She just hasn't provided it yet. So I haven't ignored that, but yes, I will continue to follow up and hopefully have some data for everybody as well.
No other comments?
Mhm.
Okay, so we're opening agenda item 13 for public comments for folks in the room. Any public comments? I see none. So moderator, can we please open up agenda item 13 for people participating on WebEx?
All right, WebEx, we are open for public comment on future agenda items. If you have a suggestion, tap that hand button at the bottom of the screen. Dial-in users, dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a few more seconds to see if we have a request for public comment. Seeing no request, you wish to continue?
Yes, thank you. I guess this is the end of our session for today, and we will recess until 9 o'clock tomorrow morning. Meeting on recess.
Yeah.